just to middle in. We don't get overwhelmed. Each and every one of you, especially those who came extremely early, for taking time to join us. Please give yourselves a round of applause. Oh, I can see those who are not clapping. They are the latecomers. So we are all going to kick off one way or the other. To do this, we would want to start with a very short prayer. The man of God in vast. Please, ladies and gentlemen, let's give it up for Mr. Solomon.
Ordained pastor. Shall we pray? Wherever you are, kindly agree with me. Our gracious and eternal God, we thank you so much for the great aspect of our deliberations this morning unto thy care. Let there be impartation of wisdom, knowledge in our midst. May we live here with a plan on paper.
What the ushers? Moderator, all the way from Kenya. Oh, please, let's do that with a round of applause. Please, please, please. Okay, thank you so much, John. Kindly introduce yourself and let's kick off.
Network Africa, and it's a pleasure to see the smiling faces this morning. Kariboni. Kariboni means Akwaba. Thank you so much.
Okay, kariboni to all our Kenyan brothers. In fact, I'm also come to give you my small Spanish. So, bienvenida. Oh, yeah. Clap it for me. Okay, so ladies and gentlemen, good morning once again. It is such an honor to stand here and do this with you. Today in the room is a mix of voice. We have people from academia, we have people from government agencies and ministries, we have people from development, CSOs present. My friend will be very insightful feedback that would carry advocacy. So please, quickly, I would want to acknowledge some few people in the house. As we wait for the rest of the dignitaries to join, we're actually waiting for the representative of the Ministry of Health. We all know we cannot do this without the health ministry. So he's such an important person that unfortunately we would need to wait a little while for him. In our midst today, we have the Assistant Commissioner for Research and Policy from the Ghana Revenue Authority in the person of Dr. Ales Combat. Dr. Combat, can you give us a wave? Thank you so much. We also have Dr. Martin Kusi, Director, Tobacco and Substance Abuse, FDA. We also have Professor of Public Health, our very own Professor Atison. We also have Mr. Stephen Alatsige, Country Director of GUI. We also have Mr. John Tomby, Policy Officer from the TGNA. We have our beautiful Chinai Mukumba, the Executive Director for the Tax Justice Network Africa. We would also want to acknowledge our media partners here this morning. We have reps from BFT, we have Maxco, and we have Spider. Is it Spider or Spider? However it is, let me tell you, I'm a baby spider. Yes, I'm a baby spider, so I unapologetically want to welcome myself in this meeting. Thank you. Yes. And then also, we have our very own, I used to call him the Encyclopedia of Tobacco Control. Today, I'll give you his new name. So please, ladies and gentlemen, let's welcome the one and only Labra Musa. Yeah, this is the only platform I get not to call him a mister. So I assume it chest high. Okay, thank you so much. I thank you so much again for coming. We'll zoom in straight away, though we are waiting for the Ministry of Health rep. We'll take some few messages. Yes, ma'am. Do we please have the rep for Ministry of Finance around? Okay, do we have the WHO rep here? WHO rep. Okay. Do we have that of the FDA? Okay. Okay, that's fine. So we can move on. Please look to your left and to your right. If I didn't introduce you, please introduce yourself to someone. You also hear some. Oh, you're not introducing yourselves. Please introduce yourself. Give someone the gentleman's handshake, you know? Yeah, I cannot hear voices. Yeah. And make sure you exchange contacts. Who knows? Who knows? Who knows? Hey, Miana Mikaya, come home, please. It looks like you're taking this thing too personal. Okay, hold on. Yeah, so we would want to take some opening remarks. We want to take some opening remarks, and to do that for us, we would have Mr. John Tommy to represent the TGNA. He is the policy officer and task equity. So please let's give it up for Mr. Tommy as he brings us the opening remarks.
Good morning. Good morning. I'm really happy to be here. So, Ghana is becoming my second home, and it happens that my dad gave birth to twins, and unfortunately, our mothers, who currently we call our mothers, uh, really did not know about that. So, when I came here for the first time years ago, but last year I got to meet my twin sister and also interested to know much about that story. I'll share with you later. But for this time, I'd like to welcome Madam Chenai, our team lead at TGNA, to give the opening remarks from TGNA. Welcome, Chenai.
Thank you, John. Good morning, everybody. I am so excited to be here. I love coming to Ghana. I feel like I should also tell my story. So, so I'm from Zimbabwe myself, and we hold so dearly the relationship that we have with Ghana. Our first lady came from here, and she really was such an incredible woman. And so I'm always thrilled to be able to come to Ghana, to come to Accra, because it feels like home. Also, allow me to thank the moderator. She's got so much energy. Thank you so much for what you're doing in the room. It really is great. So, allow me to ride on existing protocols. I'd like to recognize the representatives that we have from the government of Ghana, officials from the Ministry of Health, officials from the Ministry of Finance, officials from the Ghana Revenue Authority, representatives from the World Health Organization, our partners at Vast Ghana, members of other civil society that are in the room, development partners, colleagues, and friends. It is both an incredible pleasure and honor to join you today for the official launch of the Tobacco Tax Advocacy in Africa project here in Ghana. Today, we are gathered not only to launch a project, but to reaffirm a shared commitment to protecting public health, advancing economic justice, and strengthening domestic revenue mobilization across Africa. The Tobacco Tax Advocacy in Africa project is now entering a new phase of implementation, where we will be seeing it delivered across 8 African countries: Ghana, Kenya, Zambia, Nigeria, Senegal, South Africa, the Democratic Republic of Congo, and Namibia. Through this initiative, TGNA works with national partners, governments, researchers, health advocates, and regional institutions to generate evidence, strengthen policy dialogue, and support reforms that make tobacco products less affordable while also increasing public revenues. The rationale is straightforward. Tobacco taxation remains one of the most effective public policy interventions that are available to governments. The World Health Organization estimates that significant increases in tobacco taxes can reduce tobacco consumption faster than any other single tobacco control measure. Higher prices discourage the initiation among young people, encourage current users to quit, and also reduce the overall consumption. Importantly, these effects are strongest among youth and low-income populations, who are often the most vulnerable to nicotine addiction. And so this launch also comes at a particularly important moment. A few days ago, the world marked World No Tobacco Day 2026 under the theme Unmasking the Appeal, exposing industry tactics on tobacco and nicotine products. The theme reminded us that behind the marketing, flavors, branding, and promotion of tobacco and nicotine products lies a simple reality. These products are designed to create addiction, undermine health, and place immense burdens on families, communities, and the public. Yet tobacco taxation is not only a public health intervention, it's also a development and financing intervention. And this is particularly important when you consider current conversations that are being had across the continent about how to finance our healthcare sector. Across Africa, governments are facing incredible pressure to finance health systems, expand universal healthcare coverage, address the growing burden of non-communicable diseases, as well as build resilience against future health shocks. At the same time, many of our countries are facing fiscal constraints, rising debt burdens, and shrinking development assistance. And this is why domestic revenue mobilization is becoming more important than ever. Health taxes, including tobacco excise taxes, provide a unique opportunity to simultaneously improve health outcomes, reduce our disease burden, and generate sustainable domestic revenues. Every additional CD raised through effective tobacco taxation can contribute to reducing healthcare costs while creating fiscal space for investments in health, education, and social protection. The burden of tobacco use on African economies is significant. Tobacco-related illnesses continue to increase healthcare expenditures, reduce labor productivity, and contribute to premature deaths from cancers, cardiovascular diseases, respiratory illnesses, and other non-communicable diseases. I think the video that we just watched now gave an incredible showcase of just the type of burden that falls on our countries as a result of the tobacco industry. Fortunately, Ghana has already demonstrated leadership in this area. In 2023, the government of Ghana passed the Excise Duty Amendment Act, introducing a specific excise tax on cigarettes and other tobacco products. This represented a major policy milestone and brought Ghana closer to meeting regional commitments under the ECOWAS Tobacco Tax Directive. It was an important demonstration that evidence-based policymaking can deliver meaningful reforms. However, important opportunities remain. Further reforms can deliver even greater health and revenue gains. And so the purpose of this project, the reason for our meeting here today, is to help build on that momentum. Through our partnership with VAST and a broad coalition of other stakeholders, we aim to support evidence generation through strengthening public awareness, facilitating policy dialogue, and contributing to reforms that align tax policy with public health and development objectives. Across the continent, we are already seeing encouraging results. countries are increasingly recognizing health taxes as powerful tools for advancing domestic revenue mobilization while reducing the burden of disease. And so today marks the beginning of a new chapter in Ghana's tobacco tax advocacy journey. We're not starting from scratch. We are building upon years of progress, years of strong national leadership, and a growing recognition that health taxes are among the most important taxes that we can use in order to meet our developmental objectives. And so this morning, allow me, on behalf of TJNA, to share remarks that reflect our sincere appreciation to the government of Ghana, vast Ghana, our technical partners, our funding partners, and all the stakeholders that are supporting this work. Together, we can reduce tobacco consumption, protect future generations, strengthen domestic revenue mobilization, and contribute towards building healthier and more prosperous societies. Thank you very much.
Thank you so much, my beautiful ED. This is where I say Asante. Thank you. Yeah, so just say, I thank you for saying that this is not just a project, but it's a reaffirmation of our shared commitment to public health. That hits very hard, and we thank you for it. Yes. Okay. Next to give us the remarks. You know, we are in someone's house. If TJNA in partnership with VAST, so if TJNA has given us the go-ahead, we need the landlord to also do so. He was asking me who will introduce him. Why do I need someone to introduce him when I'm here? Okay, so this is a man that is driven by passion. This is someone who runs with a vision, regardless of whatever happens. This is someone who is focused and know where he is going. And this is someone I am proudly to say that has nurtured me in the field of advocacy. And I remember my first concept note I wrote and the remarks he gave. What is this? Yes. What is this? Yes. What is this? Just like that. But well, this is someone who sees the vision and gathered momentum to get it done. You may not see what he's seeing when you are sitting, like popular phrases. Obitna, what? When someone is on the roof, does not know what's happening down there. It's a cheap proverb. I think I've murdered it. If it were to be in Ghana, I would have done perfectly well. Okay. His advocacy has yielded results. He's not just talking. It's not always a talk show. His advocacy has yielded results. When it comes to tobacco control, he is the hub to go to. And today, I'm saying that he is
representative of the Minister of Health, here present Dr. Hafiz Tahir, representative of the Ministry of Finance, and also the Ghana Revenue Authority, the Food and Drugs Authority representative present here, representative of the WHO Ghana office, Executive Director, that's Justice Network Africa, with an able team who traveled all the way from Kenya to be with us here today. Interim board members of VAST Ghana, representative of the Global Alliance for Tobacco Control, and then also representative of the Global Health Advocacy Incubator present here today. I would also want to acknowledge the presence of the former tobacco control focal person for Ghana, Dr. Edith Wellington. Please, can we, yes, in fact, she has played her due for the country, and indeed, we are most grateful for your presence here today. I also want to acknowledge Dr. Atsing, who have traveled all the way from Kumasi to join us here today. Ladies and gentlemen, friends of the media, civil society colleagues, I really appreciate your coming here. On behalf of the Vision for Accelerated Sustainable Development, VAST Ghana, I extend a warm welcome to all of you at this important kickoff meeting for the Phase 3 Tobacco Tax Advocacy Project in Ghana. We are deeply grateful to the Tax Justice Network Africa, TGNA, for their steadfast partnership and work across Africa and in Ghana. Their support in Ghana has been instrumental in our strong advocacy that contributed to the passage of the Excise Duty Amendment Act in 2023, which was eloquently mentioned by Chinai. Through these partnerships, we have participated in key global events, strengthened our voice on the continent, and grown in a recognized hub of resource on taxation issues and also on health harming product fight in Ghana. Today marks a proud moment as we officially launch the project and also officially adoring Fast Ghana at this high-level gathering. We are excited to deepen our continuous collaboration with TGNA and all other partners to strengthen evidence-based excise tax and advocacy that protects public health and mobilizes sustainable domestic revenue and resources for Ghana's development. Let this partnership with TGNA be a beginning of greater things to come. Let us commit today to bold advocacy, evidence-based policy, and collective action that will not only reduce consumption of health-harming products, but also generate substantial resources to build stronger health system for our people across Ghana and across the continent. As we launch this new phase of the Tobacco Tax Advocacy Project, the Phase 3, I am reminded that no single organization can solve the complex challenges before us today. This burden, or the burden of tobacco and other health-harming products like alcohol, sugar-sweetened beverages, ultra-processed foods, the rising threat of non-communicable diseases, and the need for sustained health financing require all of us to work together and diligently. We must eschew working in silos. The time has come for genuine multi-sectoral collaboration. Now, I want to stress on that, genuine and meaningful multi-sectoral collaboration. I know we are already collaborating, but we need to be very genuine and also meaningful in this, between health and finance. And I want to stress on that, between health and finance, because mostly there's a disconnect. And I'm happy to know that at least for some time now, we are seeing that kind of joint venture between the Ministry of Finance and Ministry of Health, and between also government and civil society organizations. Indeed, let me say that the gap is closing gradually. We are working closely to advance public health in Ghana, and hopefully that will be cascaded in other parts of Africa and the world. And also between national and global actors. Indeed, Ghana is working closely with other partners to achieve our collective goal. When we work together, we achieve more than we have ever could done alone. On this note, I say a big welcome to everyone once again, and let me add my voice to saying Karibu to our friends from Kenya. Thank you very much for your attention.
Thank you very much, sir. Indeed, when we work together, we achieve more. And I like the fact that we are here because of collaboration and saying that the time has come for genuine, meaningful collaboration between health and finance. That makes each and every one of us here a very, very important partner in this advocacy. Moving forward, we would have some remarks from the government ministries and agencies that has graced the occasion today. And to begin for us is no other than the representative of the Ministry of the Minister of Health, actually. He is a public health specialist with over 2.5 decades of dedicated service in the public sector, a career that is defined by transformative leadership, strategic vision, and an unwavering commitment to improving lives. Dr. Adams currently serves as the Director for Technical Coordination at the Ministry of Health, occupying a central role in bridging national health policy with practical implementation. So he is someone who is vast, in fact, well vested and experienced in this field. So please, let's welcome to the podium Dr. Hafiz Adams, representing the Minister of Health. Oh, you can do it better, please. He's wearing the shoes of the minister. Let's do it better for him. Thank you.
Thank you very much, Madam MC. I will start by, rendering an apology for coming in late. You are aware, for those who know, I hardly come late. But in this case, just as I was leaving the office, I was called by the minister for an important interaction. And whilst I was in front of him, that was when I saw the call from Labram. And I realized that you were ready. So forgive me for that later. It wasn't deliberate. Having said that, I don't know whether there's a chair for this program. There's no chairman. So Labram becomes the highest because he's a convener of this meeting. So the executive director of VAS Ghana, I think that you are doing so well, you and your team. It's not just the issue of tobacco, but also I know how you are involved in the issue of alcohol as well and all those things. In fact, these are all values that we are looking up to in order that we'll be able to address the issue of NCD, because for us in the health sector, we know how directly related alcohol and tobacco issues are when it comes to, NCDs. Just 3 days ago, I think we launched the No Tobacco World Day, and we interacted. And so let me start by saying that on behalf of the Minister of Health, Honorable Kwabena Minta Kando, I bring you warm greetings from him. He's just preparing to go to the big house. The reason why he's not here personally, the Deputy Minister as well is out. In fact, we're supposed to be together at the border to look at our preparedness as we are getting towards possible, registration of Ebola. So we are running around. That's why none of them is here. So, distinguished representative of the Ministry of Finance, the Ghana Revenue Authority, the World Health Organization, Tax Justice Network Africa. I've already addressed Labran in the name of VAST. Colleagues from government institutions, civil society organization, academia, development partners, ladies and gentlemen, if I haven't mentioned you, you are part of the distinguished guests. Good morning. So it is both an honor and a pleasure to join you today on behalf of the Ministry of Health for the official launch of the Phase 3 of the Tobacco Tax Advocacy in Africa. The project in Ghana. At the outset, allow me to express our sincere appreciation to the Tax Justice Network Africa, TJNA. Where are they? Can I see you? Very well. So I know I'm talking to you directly. For your leadership and strategic commitment to advancing equitable taxation, health financing, and sustainable development across African continent. We equally commend VAS Ghana for its unwavering dedication to public health advocacy and tobacco control. The partnership between TJNA, VAS Ghana, government institutions, and other stakeholders demonstrates the power of collaboration in driving evidence-based policy reforms. As a country, Ghana continues to face the significant health economic consequences of tobacco use. While adult tobacco prevalence remains relatively low, at less than 5%, tobacco-related illnesses are responsible for more than 6,700 deaths annually. This is a big number. The associated economic burden exceeds 668 million Ghana cedis each year through healthcare costs, lost productivity, and premature mortality. The figures serve as a stark reminder that tobacco control remains both a public health imperative and a development priority. The launch of this project is particularly timely, coming on the heels of Ghana's commemoration of World No Tobacco Day 2026 under the global theme and masking the appeal countering nicotine and tobacco addiction. This year's campaign highlights the increasingly sophisticated tactics employed by the tobacco and nicotine industry to attract and retain consumers, especially the young people. Through the flavors, appealing packaging, emerging nicotine products, and aggressive marketing strategies. And I think whilst we were launching that, they brought us samples. And for the first time, we saw a watch that was a cigarette, where you press, it comes out, and then you pull out the what do you call it, the smoke that can form a cumulonimbus, weather to be able to cause rain. That is how far they have gone. They have gone far to even now entice it with flavors such as strawberry. So now know that it's not just ice cream that has strawberry. So in this case, we are especially encouraged by the recent passage of the Excise Duty Amendment Bill, a significant policy milestone that reinforces Ghana's commitment to using fiscal measures to promote public health while strengthening domestic resource mobilization. This achievement illustrates what can be accomplished through sustained advocacy, strong political commitment, and effective collaboration between government agencies, civil society organizations, and in fact, development partners. So the Ministry of Health recognizes and appreciates the invaluable contribution by VAST Ghana to tobacco control efforts in this country. Over the years, the organization has generated high-quality evidence policy reports that have informed national discussions and decision-making. VAST Ghana has effectively represented civil society on the monitoring and reporting of Ghana's tobacco control strategic plan and has played an important role within the technical working group responsible for developing draft guidelines for the enforcement of tobacco advertising, promotion, and sophisticated and also sponsorship provisions under the Tobacco Control Regulation 2016 LI 2247. Distinguished ladies and gentlemen, I also recall with appreciation the building capacity in industry monitoring and effective tobacco control advocacy in Africa training program hosted by VAS Ghana in Accra last year. I had the privilege of participating in that important initiative, which brought together advocates, journalists, researchers, and policymakers to strengthen capacity of monitoring and countering tobacco industry interferences. Such efforts are critical to safeguarding public health policies from vested commercial interests. The international recognition that VAS has received, including the WHO World No Tobacco Day Award and the Universal Health Coverage Champion Award, two big awards. Please, let's acknowledge them. Some other organizations, such as theirs, are busily sponsoring beauty pageants and other things that have no role when it comes to our health issues. And so remember that health first before you can even dance. And so I feel that we have to encourage them in order that others can be willing or will be willing to also contribute in the efforts in minimizing the impact of tobacco as far as our health is concerned. So the Ministry of Health remains steadfast in its commitment to reducing the burden of non-communicable diseases as part of our broader agenda to achieve UHC. Through initiatives such as the Ghana Medical Trust Fund and our efforts to expand access to free primary healthcare services, we continue to give priority for prevention, early detection, and sustainable financing mechanisms that improve health outcomes for all Ghanaians. We therefore view the Tobacco Tax Advocacy in Africa project as a timely and strategic opportunity to deepen multi-sectoral collaboration, strengthen evidence-based policymaking, enhance domestic resource mobilization, and accelerate progress towards our national health and development goals. Distinguished ladies and gentlemen, as we commence this new phase of work, let us remain united in our shared vision of a healthier Ghana. One where effective tobacco control policies save lives, protect future generations, and contribute to sustainable national development. As I conclude, distinguished ladies and gentlemen, I'm confident that today's deliberation will generate valuable insights and a clear roadmap for action in the years ahead. Obake, Akwaba, Miawezo, welcome. Thank you for your attention, and I wish you all a successful, productive meeting, and may the good Lord bless us all. Thank you.
Thank you so much, Doc. Indeed, together, our insights will promote public health gains. And this reminds me of a quote by David Vine that says that the true face of smoking is disease, death, and horror, not the glamour and sophistication the pushers in the tobacco industry try to portray. Doc just told us about the cigarette and gun and other beautiful shapes and flavors. So we should know the true meaning behind this sophistication. Moving forward in the remarks, we would have a very usual and familiar face here. He has been with the organization since its advocacy in calling for a change in the tax regime. And he actually is a PhD holder in environmental economics, that is environmental taxation. So when it comes to issues of taxation, he is well vested. He is this morning representing the Ministry of Finance. Please, ladies and gentlemen, giving Hannah to whom Hannah is due, let's put our hands together as we welcome Dr. Alex Combat to the podium. Oh, please, let's do it better for him, please. Thank you very much.
Good morning, everyone. I'm extremely happy to be here, and greetings from the ministry, GRA, our authorities. I have a statement here I'll be reading on behalf of these two institutions. Actually, it's like a mother and son. So we are together. So I'll just read a statement from them. So we from GRA, Ministry of Finance, are extremely happy to be part of the launch of the Tobacco Tax Advocacy project in Ghana. Ladies and gentlemen, we are all aware of the harmful effects of the products that attract excise taxes in Ghana, namely tobacco products, alcoholic beverages, wines and spirits, flavored water, carbonated drinks, sugar-sweetened beverages, and plastics. For instance, tobacco-related illnesses account for 3% of the deaths in the country. So we are aware of this. It costs Ghana 668 million Ghana cedis every year, equivalent of 0.2% of GDP, to take care of tobacco-related illnesses. Alcohol consumption is considered the leading cause of deaths in Ghana, with over 200 health conditions linked to the harmful consumption of this product. In fact, every year, someone dies of alcohol-related disease in Ghana. Diabetes-related deaths are about 3.4% of total deaths. There are also environmental dangers associated with plastics, the use of plastics. So generally, people continue to consume these products because they are not expensive enough. And so Ministry of Finance, government, GRA has seen the need to put taxes on them to increase their prices to deter people from consuming them in large quantities. In fact, over the years, GRA has used taxes, custom duties, value-added tax, national health insurance levy, and the rest at entry points and at domestic front to discourage consumption of these products in line with Article 6 of the WHO FCTC and Articles 8 and 9 of the ECOWAS Directive. GRA, as a tax implementer, will continue to administer excise taxes professionally and raise the needed revenue to support healthcare in Ghana. In all, GRA collected 8.7 billion from 2020 to 2025, with average growth of 19.78 in terms of excise taxes. Additionally, excise tax revenue has increased from 2.2 billion in 2024 to 2.6 billion in 2025, representing about 27% growth. It is our hope that the revenue accruing from the tax will be used to support health programs. In conclusion, we wish to state that GRA will never renege in its effort to support all relevant stakeholders, including FDA, FAST, in their quest effort to fight consumption of harmful products in the country. Thank you very much.
Thank you so much, Dr. Combat. We appreciate your relentless support to this advocacy. We really mean it, and it matters most to us. We have seen the background from the beginning. We've walked you through the devastating effects of tobacco consumption. We have seen the impact on health. We have seen the impact on the environment and even in the economy. It has diverse impacts. So this project, the tobacco tax advocacy in Africa project, is very, very timely. To give us a very detailed, actually dissect the project for us, give us details. What is the project going to do? What does it entail? Give us everything that we need to know about the project and why you actually need our support. It's like a manifesto. So we are going to put him on the spot. Let him give us the details, why he needs our support. Let's weigh the options and see if truly we'll give him our support. So we are going to be very keen, very enlightened, and very alert as he comes and mounts the podium, giving us the brief of what the T2A2 project is all about. Please, with a round of applause, let's welcome once again to the podium, Mr. Tembi. Oh, please. Let's do it better. Let's do it better. Let's do it better.
Thank you. Thank you. Once again, great. You can't hear me? You can't see my voice? Okay. as the IT work on that. So my work, I want to say it's a bit simple, but at the same time, a bit hard. Because if I don't make you understand why we are here, why phase 3, then probably we might not have anything going on in Ghana regarding the specific project that we are running. So first and foremost, I would really want to appreciate Labram and the team. And in our spaces, I like to refer him as the Phoenix. He knows why, and probably a few other people in the room know why I refer to him as the Phoenix. And so we've been in Ghana. This is not our first time. We've been in Ghana for this is the 4th year. Yeah, this is the 4th year, and the successes that Ghana people, the stakeholders within Ghana, be it the Ministry of Health, Ministry of Finance, other stakeholders in the space have demonstrated and their willingness. It does not really just portray the success stories here in Ghana, but as a continent and even at the global stage. And probably that's why you have so many awards from the WHO here in Ghana. And also as a project, we really appreciate and we keep on citing about the wins and the successes in Ghana. So just to start and say who TGNA is. So the Tax Justice Network Africa is a Pan-African institution, a network of civil society organizations currently present in 26 African countries with a membership of more than 50 civil society organizations. And being present in 26 African countries, it does not mean the other around 28 African states are not represented. We like boasting about this, that we are the leading negotiators of the UN Tax Convention for African players or for the African states and the civil society organizations. So that shows how passionate we are about African matters. And it is all about having African agenda represented and done the African way. Hello, are we together? Yeah, so my slide is up. And the current thematic focus areas that we have, and these will be changing soon, probably in the next few months, we'll be talking about a larger and a broader scope. But currently we focus on 4 thematic areas, and that is tax and international financial architecture, tax and investment, tax and natural resources governance, fair and equitable taxation. So this project falls on the 4th pillar or on the 4th thematic area, which is fair and equitable taxation. So as we focus on tobacco taxation and just trying to understand why tobacco taxation, we also realize that as the representative from Dr. Alex from the Ministry of Finance and Revenue Authority mentioned, he mentioned a number of products which go beyond tobacco. And all these products are categorized as harmful products. And probably the Ministry of Health can give you further details on how or to what extent they are harmful. But when you again go back to the Ministry of Finance, you realize that the productivity of the country, the development and growth of the country relies heavily on how much the population is productive. And that's why we come to you and we want to have a talk with you. Look into the policies that you've put in place. Do they really support the productivity of the people of Ghana? Do they really speak to each other? be it when you do revenue mobilization, resource mobilization, and all that, do your policies speak to each other? Does the tax policies that you've put in place, are they effective? So that's basically what the project looks into. And therefore, when you look at these two quotes, they speak directly to the products that we focus. And the first one is from the former minister of Norway, Prime Minister, and it says, a cigarette is the only consumer product that when used as directed, kills its consumer. The first video that we had, there was an argument or a defense in court. And one of the presenters in court was talking of the effects of cigarette. And in one way or another, if you consume this product, that item there in black is like your ultimate destiny. So every smoke or every filter you consume, it reduces your days, right? Then Dr. Tedros says, taxing tobacco is one of the most effective and impactful interventions governments can implement. It works. It saves lives and it pays for itself. Every country has the power to protect its people from tobacco. And the Revenue Authority will tell you, collecting taxes from tobacco is one of the, we use money to collect money, right? Revenue Authority, right? They use money to collect money. But for taxes on harmful products, or what now we refer to as health taxes, and you'll see the definition that I'll give on what health taxes are in the next slide. It is so easy. We pay our parliamentarians to go debate and enact laws in parliament, right? So already the cost of having policies in place is catered for. Once that is done, the policies are in place, then it is upon the industry players to collect the tax and submit it to the Revenue Authority and then to Treasury and then for expenditure. So it is that easy. There are no new structures that will be put in place to have such a policy or the collection of these taxes or any other expenditure that the government will need to incur. And so when we run this project, our ED mentioned that we are currently in 8 countries. And those countries are represented by the partners that you can see here. So in Kenya, in Nigeria, in Senegal, in South Africa, in Zambia, in Ghana, in DRC, and in Namibia, we have those partners. But over and above that, we also thought that it will be good that we onboard technical partners. And therefore, we have technical partners based in South Africa, the University of Cape Town, and another partner in Senegal, Dakar, and that is CRES. We also partner with the World Health Organization and ETAF, which simply brings together the revenue authorities across Africa. So wherever you fall in as a stakeholder, be a researcher, your interests and your thoughts are well captured under this project. So in responding to why are we here or what are we aiming to do in Ghana, and this is cross-cutting across all the other African countries that we run this project in. So the project is two-tiered, or it is operated in 2 levels. So we have the TGNA, or the Tax Justice Network Africa, supporting at a continental and at a global level, doing the negotiation, doing the discussions with the the regional economic communities, trying to discuss with ECOWAS, the SADC, EAC, the African Union. And then at national level, it's where we have the National Civil Society Organization, the VAST in Ghana, negotiating and trying as much as possible to have policies that are homegrown. So we don't want to see the case where something is discussed in Addis Ababa at AU level, and then you are told, take this, adopt it as it is. We really appreciate that our governments, our ecosystems are different, and you need to have your own homemade solutions. And that's why when it comes to now proposing policies and championing for policies, we have our national partners coming into place. So the first outcome that we hope to achieve reads, selected members of TGNA, and there I'll put VAST, continue to remain an essential and trusted government resource on tobacco tax and tobacco economics in their respective countries. So whenever the government wants to interact or other stakeholders wants to get credible information regarding tobacco taxation, regarding tobacco economics, then we'll have VAST coming in to support. So if you want to do research, if you want to get some more information about what is happening, if you want to compare the policy implementation in other countries, VAST will be there to offer that support. And we work closely with them. So whenever a request goes to them, whatever they can't handle, they can elevate to us. Then together with other partners, we can be able to come together and jointly address those concerns. The second one is predictable and sustained increase in price of most popular brand of cigarettes. So we also appreciate that as time goes by, there are several issues that come into play. There is the inflation, there are considerations in terms of how to increase taxes, there are considerations in terms of the tax structure. I understand and appreciate that now Ghana has a mixed excise structure for tobacco taxation, and probably discussions on whether to have a uniform system or strengthen the existing system. So those are discussions that, again, we can engage on, and we really appreciate that, again, our national partner will spearhead such discussions. Then reduced gender biases in tax policies. Over time, in our first and second phases of implementation, we also learned that as we structure and develop tax policies, the issue of women, when it comes to gender, the issue of youths is a bit neglected. So we discuss about gender when it comes to roles and responsibilities in our organizations, but we forget that even when we formulate policies within consumer products, within tax discussions, we forget to bring on board the women and youths. And one of the things that Mr. Labram highlighted is that Africa is continuously becoming a target, because once you get a youth addicted to a product, then you are almost certain that for the next years of his or her lifetime, he would be a consumer of your product. So that is like a given surety of a market. So on engaging on gender biases in tax policies, we really need to address that concern. And therefore, this project will also look into that. Then number 4 is a strengthened capacity of revenue authorities to implement effective tobacco tax policy. I appreciate that, again, already there has been discussions, there has been capacity building sessions, but we'll appreciate having more and more of that. So the tobacco industry and the products that are sold as nicotine pouches keep on evolving very fast. It means the market is mutating very fast. And therefore, sometimes the policies play a catch-up role, which is, again, very hard. But when we partner together and support the monitoring process, continuously improving and upgrading our knowledge, then we'll be able to sustain the momentum in terms of safeguarding our public health. And lastly is increased and sustainable public health financing through enhanced compliance with WHO FCTC Article 26 to provide funding for tobacco control policies. So most of us here are aware or in terms of what is happening in the health space and the funding. So some years ago, the USAID fund was cut, and most of our health funding drastically reduced. ODS reduced, and therefore it became very hard to sustain the programs that were running in the healthcare systems within our economies. So the number 5 outcome tries to look how can we bridge that gap? How can we attain sustainability? How can African countries finance the critical social services that they have? And therefore, we look at that trade-off that we can have. So is it possible for us to change and have a better model of financing our own initiative, our own health programs? So the project also looks into that. And if we are able to achieve all these 5 outcomes, then we'll come back here to celebrate. And so, why health taxation? Why does it matter? Because now we are again now expanding. Because health taxation is not merely about tobacco taxation. It's about questioning harmful products, alcohol, sugar-sweetened beverages. There's been a mention of plastics and such. So health taxes on unhealthy products is designed to improve people's health by making harmful goods more expensive and less used public health revenue, and just to support equity benefits. So when you look at that broader mandate, then it means, unlike the first and the second phase, where the discussion was mainly centered on tobacco taxation, we are now going bigger. We are opening up because, again, most of the governments highlighted that it is hard to have a silo or a concentrated discussion around tobacco alone. And we said, yes, we are up to the task and we can engage you as long as you have the goodwill to expand on the engagement and on board the other products. So just looking at our implementation, what have we been able to achieve over the first and the second phases of implementation? So we have Namibia, we have Senegal, we have DRC, we have Nigeria, we have Ghana, we have Kenya, we have Zambia, and we have Somalia. And not Somalia, South Africa, sorry. One of the things that we do is ensuring that our advocacy is evidence-based. And we have a tool which we call simulation, TETSIM, Tobacco Excise Simulation Model, which simply puts together data or information on revenue, on inflation, and consumption together. And then on the output side, it helps you understand, by adopting a certain tax policy, what would be the outcome? How many deaths would you have averted? How much as revenue would you have mobilized by implementing that? It also questions and queries the policies. How strong are your tobacco control policies? How strong are your tax policies? Do they really talk to the current challenges that you face in the space? And through that, in the different countries, I'll just like to share a few things that we've been able to find out, and later on also share the achievement. You realize that through the assessment findings and sharing them with the government, sharing them with the other policy players, we've had some achievements. For instance, in Kenya in 2024, through the advocacy and the push that we've had from our national partner there and other partners within the tobacco control space, there was a review of the excise tax to 4,100 Kenyan shillings per 1,000 cigarettes, and also a uniform excise system for tobacco taxes, which replaced the dual rate system. In Nigeria, the annual specific taxes were increased or were changed, and that is in 2022. But again, we found that they did not account for inflation. So we went back to them, and the discussion was, why can't you onboard inflation indexation into your annual reviews? And through that, our advocacy now was more centered on not just reviewing the tax, not just doing the reforms, but putting into place an effective reform. And therefore, these are some of the 2 or 3 things that we actually emphasize on. That over time, you need to consistently review the tax reforms that you have, the tax rates, check, are they working for you? The tax structure, is it still effective? Then also take into account the inflation and the income growth. So for instance, if last year but one you are having 10%, then today, if you check that 10%, would it be still effective? So those are some of the questions that you should be able to consistently be asking. So you might be asking yourself, has it been all rosy? Has it been an easier and a smooth ride all along? And I'll tell you no. And these are some of the challenges that we've been facing. We've not been exempted from industry interference all along. So you advocate, you have the policies. I know when you are moving from ad valorem system to a mixed system, we were keenly following, and we could see some of you in parliament trying to ensure that the promises that your parliamentarians had given you, they walk with it to the end. So these are some of the challenges that we face, or countries that implement this project face. So weak implementation and compliance, sometimes the policies are in place, but the enforcement and implementation is not there. Low and ineffective tax design, some taxes are not effective, and therefore to just review them becomes a tall order, become a whole process. But again, that's why we are here. So it's upon us to collaboratively, consistently review and keep on pushing for better tax designs and tax reforms. Limited regional coordination and external pressures. So when you talk about coordination, the issue of illicit trade comes into place. So you've now been able to align your policies with the ECOWAS directives, but probably your neighbors have not been able to do as such. And therefore that again becomes a challenge to you. So these are some of the issues that come into play. I know you can all recognize that flag, right? And you can smile about it. Congratulations, Ghana. Why congratulations? And my data is a bit outdated, but this success story is what we sell to the whole world. And the question today to Ghana, can we be able to sustain this success? Can we be able to replicate the same success to the other products? Can we? Can we? Yeah, it is very possible. And that's why Tijene is back to Ghana, fully loaded, ready to work with you in a bigger way. Because we know you can. You managed to change your excise regime to a better one. We can replicate this to alcohol. We can replicate this to sugar sweetened beverages. And we can keep on strengthening this. And that's why I leave you with that. Right? We can. Thank you very much.
Oh, please keep clapping, keep clapping, keep clapping, keep clapping. Okay, thank you so much, Mr. Tembi. At least you didn't fail us. Did he fail us? So are we going to support the call? Okay, that is great. In particularly, I am really overwhelmed and I'm thrilled by the aspect of gender. I'm gender biased. And in all policies, especially in tobacco taxation, like you said, the gap has been the inclusion of gender. And so if now we are bringing the gender issue on board, it makes it more inclusive because we, the women, the other gender they refer us, we are those that bear the brunt when you are sick and you are bedridden. When you are going to the hospitals, it affects us because now we are drained emotionally, we are drained mentally, and economically, we are overburdened. So for me, I dove off my heart for you. Let's give it up again for that. Okay. I can see a lot of dot coms. Do you know the dot coms? The dot coms. I can see a lot of dot coms around. We are just left with one more presentation and have our health break. But please, let's be upstanding. We've been sitting for long. Let's be upstanding. Let's be upstanding. This is where I need you, John. Let's be upstanding. The dot coms are over dot comming. We are going to do just a very simple warm-up. Let me see how attentive we all are in this room. Please, I need you to hold the microphone for me. Unfortunately, height differences. I'm sorry. I cannot help it.
I identify as tall.
Okay. So we are going to do a simple activity. You do whatever I say. Whatever. So have you seen your eye? So have you seen? No, have you seen? Good, good. You are good students from this side. Have you seen or heard of Mr. Hedy, who was needed in the army? To my left, to my right, hip hip, hooray. Okay, we are going to do it one more time. This time very faster. Have you seen or heard of Mr. Hedy, who was needed in the army? To my right, to my left, hip hip. Okay, now this is where the trick is. You are going to say exactly opposite of what you are going to do, opposite of what I will say. Opposite of what I will say. Let's see. In fact, this one, please be choking them. The last man standing will receive an award. Okay. Have you seen? Ah, people have you seen eyes? Oh, eating. We are doing directly opposite of what I will say. Opposite. You are not doing exactly. Yeah, so you're going to do the opposite of what I will say. Anything except what I will say. Anything else from what I will say. Anything else from what I will say. So have you seen? Okay, now we are all awake. We are all awake. Okay. We are all awake. Thank you so much. Okay, let's resume our seats and take the final presentation. The final presentation is going to come from Dr. Alex Combat. He's going to run us through Ghana's excess tax policy. So we all know that Ghana has actually shifted from the ad valorem tax policy. So this took a lot of effort, a lot of advocacy, and I was very honored to be part of such an advocacy. I remember Mr. Labram and the team always going for meetings in the GRA conference room. I think that was my first time working with them, 31st December, I will not forget. And he took me to an excess tax meeting where they are using all the terminologies, ad valorem, and I didn't even know how to spell it. Excess tax, shift, miss, and everything was confusing. At the end of the day, you need to come up with a report. How do you do that? But then it served a ground for learning. It served the ground for bigger prospects. And the advocacy grew out of the small conference room of GRA to meeting with other stakeholders, meeting with the FDA, other CSOs, and we garnered the people. And truly, on that day when the budget was read, I was home when Mr. Labram sent me a message. Have you seen the budget? And I was very proud to open the budget, go back and actually read. And voila, our call was included in the budget. Please, let's give a round of applause to the organization and Mr. Labram. They've done extremely very well. Laying the foundation of how we have come so far, let's give it up for Dr. Alex Combat as he runs us through the Ghana's tax regime.
Thank you very much for the opportunity. We gave a statement and we are making a presentation and we'll be on a panel, so it will be very brief, just about 10 minutes, and then we are gone. If you can have the slides. Yeah, so you can go on. Please go on. So this will be the content, about 8 topics. Each slide will just be one topic and we are done. So you can go on. Now, when you look on the right-hand side of my slide, you see that some of the bars are in red. You can see that some of the bars are in red. So this is the problem. And when you look at the Ghanaian Constitution, when you look at Article 34, it requires that the government actually implement measures to take care of the health conditions of Ghanaians, make sure that Ghanaians are healthy. So based on this, Ghana has implemented taxes on certain products. I already mentioned that, or mentioned them in my statement, so you can see them. So we are talking about tobacco, carbonated drinks, energy drinks, SSBs, you can name them. And most often the taxes are levied at both the domestic and then at the international front when it comes to imposition of these taxes. And they are mainly ad valorem and then specific. We can go on to the next slide. So what is the rationale when it comes to implementation of these taxes? So 1, revenue purposes. 2, to reduce consumption of these harmful products. I already mentioned them. And then 3, reduce health. So let me go this way. So reduce the health risk or the health care burden of consumption of these products, and then reduce NCD risk. So these are the 4 main rationale for implementation of these taxes. When it comes to Ministry of Health, GRA, this is our key thing. So let's go on. Okay. Now, so aside tobacco, that the tax is imposed at the entry point, the rest you can have them at the local level and then at the entry points. Please, the tobacco taxes, the tobacco tax implementation in Ghana is actually in line with Article 6 of the WHO FCTD, that is WHO Framework Convention on Tobacco Control, so Article 6. And then it is also, when it comes to excise taxes, we make sure that we align with ECOWAS. ECOWAS has a directive, and when you look at chapters 8 and 9, the directive or protocol outlines how members should implement the excise taxes. Later I'll show you that. And we have complied. Now, when it comes to importation of tobacco, currently we do not produce. So tobacco mainly comes from Nigeria. So you can see the CIF value when it comes to Nigeria. And then even the net mass. The next is Vietnam, UAE, We have China, Dominican Republic, Bulgaria, and then the rest. So these are the countries that we get our tobacco from. You can go on. Yeah, when it comes to the main laws governing excise tax, I already mentioned the Constitution, Article Article 34, 1 and 2. We have the Excise Duty Act 878. We have the Excise Duty Amendment Act 2023, 1108, Excise Stamp Act 873, and then we have the regulation. We have the Value Added Tax. We have the Customs Act. We have the Ghana Education Trust Fund Act, Revenue Administration Act, and then we have the National Health Insurance Act. Please, anytime we are imposing tax on these accessible products, they attract all these taxes. Aside the excise taxes, they attract all these taxes. And who are the institutions actually implementing these taxes? So at the domestic front, we have the Domestic Tax Revenue Division, and at the customs side, we have the Customs Division, the international ones. So Customs Division actually implement or collect the taxes on our behalf. You can go on. Now, when it comes to the excise tax reforms, so we have a lot of them. The gentleman who presented said you needed to applaud Ghana, and this is what he was talking about. We've had a lot of reforms when it comes to implementation of excise taxes. So we are talking about the amendment, the Act 1108. Then we increase the rate of snoof and Negro head, introduction of mixed tax regime. Then the amendments were actually in line with the ECOWAS directive, and that is the ECOWAS directive. Countries should introduce or implement tobacco tax based on that. And then we also have tax on electronic cigarettes. We've been fighting with FDA because they don't allow us to tax it, so we are still on it. Increase in the rates of alcohol, SSB, tax on SSBs was also introduced. Reduction in the rate of plastic tax, it was 10%, it came to 5%. And currently, we are reviewing the Excise Duty Act, that is the 2014, the 878. Last week, there was a stakeholder engagement on it. And I was extremely excited to see FAST there. And they made a lot of contributions. GRA asked them to present a paper. And yesterday, Mr. Labran sent me the paper. I have forwarded it to the Ministry of Finance. So he has identified some gaps when it comes to implementation of the Excise Duty Act. And we forwarded the proposals, and we hope that there will be change. We can go on. 10 minutes, you can stop me. So when it comes to successes of the tax, we have a lot of success stories to tell. And these are the success stories. So one, the excise tax revenue. So you can see it has been increasing. It has been increasing. I've just got this from our database, and you can see that from 2020, it was 609, and currently we are talking about 8738. This is in millions, so you can just convert it by putting a point here, and you get it in billions. So it has increased. Now, when it comes to the prevalence, that is also very good. Ghana has the lowest now, which is also very good for us. Now, have you seen the health expenditure per capita? It is also falling. That is also very good for us. This is for Ghana. This is the red one. The red line is for WHO. That is their requirement, 86. And currently, it went up to about 98, 96, but currently it is dropping. So that is the good news to tell you that the health taxes are actually working. Let's go to the next. Yeah, so we have increase in prices of these products. So after the amendment of the act, we saw uh, uh, prices increase for the alcoholic beverages and cigarettes. A pack also increased. Prices of SSBs increased. I mean, you can testify, you can bear with me when you go to buy these products. And then currently we were at 16%. After the implementation, we've gone to 47%. WHO requirement is 75%. We are looking at a tax share in the retail price of the product. And so we are going at 47 currently from 16%. So what it means is that we'll get there. Now, we had the UNDP carry out some research to look at our health taxes, whether they were doing very well. And you can see the scores. The scores are very encouraging, is that not it? Preventing non-communicable diseases, the score was C. Discouraging alcohol consumption, we scored what? CB. Reducing the consumption of tobacco products, we scored what? AA. So what it means is that we are doing very well. So when it comes to using excise taxes to reduce consumption of some of these products, I think we are doing well when it comes to. Ghana did not do it. We had a third party to do that for us, and we were happy to see the score as compared to other countries. Can we go on? How many more minutes? Oh, 1 more minute. Okay, I can go on. I'll try. Please go on. Now, we just try to compare Ghana's excise tax and in terms of other countries. So we looked at the products and wanted to know whether we have complied. So when it comes to tobacco, we have complied. So you can clap for us. When it comes to alcohol, we have complied. When it comes to SSB, we have complied. We are looking at the directive. When it comes to water, we did not, because the directive says we shouldn't impose tax on water. And we have gone ahead to do that, so they are not happy with us. And then when it comes to plastics, we have complied. Energy drinks, we have complied. Let's go on to the next. Now, when it comes to the tobacco excise tax regime in West Africa, it is only Ghana and Cape Verde that has a mixed regime. The rest are all admirable. And when you look at the share of tobacco tax, when it comes to the retail price, Ghana is at 47. The only country doing very well here will be Senegal. Senegal has 70%. Ghana has 47%. Ghana is second. Is Ghana second? I think so. Ghana is second, right? Yeah, so we have done very well in this regard as well. Let's go on to the next. I have a few seconds to finish. Go on to the next slide. Okay, there was a previous slide. Yeah, so this is in terms of SSBs and alcohol, and then we have complied as well. And then when it comes to how to check illicit, we are doing well. Vigilance, arrest, seizures, introduction of technology. We are currently using drones. The excise tax stamp is helping. Tobacco has become a restricted product. Informants are what? And then we also have some dogs that they are using to actually check illicit. You can go on to the next. Okay, challenges. So the tax is not designed based on the WHO ITPs, and that is the problem. And then we have industry interference, informal nature of our borders, paucity of research, and then we have specific rates are not adjusted to inflation. So these are some of the challenges we are facing. And I think Labran did well. He touched on all these regarding the proposal. What's the next? The next is conclusion. So we have our recommendations and then the conclusion. Very thankful.
Thank you so much, Dr. Alex Combat. It's good to know that we are doing well as a country when it comes to our tax regime. I'm sure Dr. Alex would add on in the panel discussion. But for now, We'll take a very quick health break. Some people need to visit the washroom, people need to stretch. Before we do that, we'll take a group photograph outside. So please kindly follow John. Yes, John, he's behind with his hands up. He would take us to where we are taking the pictures. So quickly we'll take the pictures, have some snack, visit the washrooms, and that will be it. Please, we are doing this in 10 minutes. So let's be time conscious. We are doing this in 10 minutes. Thank you.
My name is Prince Watson. I am a general art student from Kimbu Senior High Technical School. I choose my dreams, health, and my future over tobacco products. Thank you very much.
Hello everyone, I am Ramzia Adamu, a student of Kimbu Senior High Technical School. Strong minds make healthier choices. I say no to tobacco, vapes and shisha. Thank you.
I am Emmanuel Kofi from Kimbu Senior Technical, a general student. I'm addicted to success, not tobacco.
I'm Hawa Abdullah, a general art student from Kimbu Senior High Technical School. Education, ambition, and good health will take me to places and not tobacco. Thank you.
Hello, lovely people. I am Anita Nanauma Ajemai, a general science student from Kimbu Senior High Technical School. My friends, know this. Every tobacco-free choice you make brings you closer to your goals. Thank you.
My name is Prince Watson. I am a general art student from Kimbu Senior High Technical School. I choose my dreams, my health, and my future over tobacco products. Thank you very much.
Hello everyone, I am Ramzia Adamu, a student of Kimbu Senior High Technical School. Strong minds make healthier choices. I say no to tobacco, vapes and shisha. Thank you.
I am Emmanuel Kofi from Kimbu Senior Technical, a general student. I'm addicted to success, not tobacco.
I'm Hawa Abdullah, a general art student from Kimbu Senior High Technical School. Education, ambition, and good health will take me to places and not tobacco. Thank you.
Hello, lovely people. I am Anita Nanauma Ajemai, a general science student from Kimbu Senior High Technical School. My friends, know this. Every tobacco-free choice you make brings you closer to your goals. Thank you.
My name is Prince Watson. I am a general art student from Kimbu Senior High Technical School. I choose my dreams, my health, and my future over tobacco products. Thank you very much.
Hello everyone, I am Ramzia Adamu, a student of Kimbu Senior High Technical School. Strong minds make healthier choices. I say no to tobacco, vapes and shisha. Thank you.
I am Emmanuel Kofi from Kimbu Senior Technical, a general student. I'm addicted to success, not tobacco.
I'm Hawa Abdullah, a general art student from Kimbu Senior High Technical School. Education, ambition, and good health will take me to places and not tobacco. Thank you.
Hello, lovely people. I am Anita Nanauma Ajemai, a general science student from Kimbu Senior High Technical School. My friends, know this. Every tobacco-free choice you make brings you closer to your goals. Thank you.
My name is Prince Watson. I am a general art student from Kimbu Senior High Technical School. I choose my dreams, my health, and my future over tobacco products. Thank you very much.
Hello everyone, I am Ramzia Adamu, a student of Kimbu Senior High Technical School. Strong minds make healthier choices. I say no to tobacco, vapes and shisha. Thank you.
I am Emmanuel Kofi from Kimbu Senior Technical, a general student. I'm addicted to success, not tobacco.
I'm Hawa Abdullah, a general art student from Kimbu Senior High Technical School. Education, ambition, and good health will take me to places and not tobacco. Thank you.
Hello, lovely people. I am Anita Nanauma Ajemai, a general science student from Kimbu Senior High Technical School. My friends, know this. Every tobacco-free choice you make brings you closer to your goals. Thank you.
My name is Prince Watson. I am a general art student from Kimbu Senior High Technical School. I choose my dreams, my health, and my future over tobacco products. Thank you very much.
Hello everyone, I am Ramzia Adamu, a student of Kimbu Senior High Technical School. Strong minds make healthier choices. I say no to tobacco, vapes and shisha. Thank you.
I am Emmanuel Brady Kofi from Kimusina Technical and general student. I'm addicted to success, not tobacco.
I'm Hawa Abdullah, a general art student from Kimbu Senior High Technical School. Education, ambition, and good health will take me to places and not tobacco. Thank you.
Hello, lovely people. I am Anita Nanauma Ajemai, a general science student from Kimbu Senior High Technical School. My friends, know this. Every tobacco-free choice you make brings you closer to your goals. Thank you.
My name is Prince Watson. I am a general art student from Kimbu Senior High Technical School. I choose my dreams, my health, and my future over tobacco products. Thank you very much.
Hello everyone, I am Ramzia Adamu, a student of Kimbu Senior High Technical School. Strong minds make healthier choices. I say no to tobacco, vapes and shisha. Thank you.
I am Emmanuel Brady Kofi from Kimusina Technical and general student. I'm addicted to success, not tobacco.
I'm Hawa Abdullah, a general art student from Kimbu Senior High Technical School. Education, ambition, and good health will take me to places and not tobacco. Thank you.
Hello, lovely people. I am Anita Nanauma Ajemai, a general science student from Kimbu Senior High Technical School. My friends, know this. Every tobacco-free choice you make brings you closer to your goals. Thank you.
My name is Prince Watson. I am a general art student from Kimbu Senior High Technical School. I choose my dreams, my health, and my future over tobacco products. Thank you very much.
Hello everyone, I am Ramzia Adamu, a student of Kimbu Senior High Technical School. Strong minds make healthier choices. I say no to tobacco, vapes and shisha. Thank you.
I am Emmanuel Brady Kofi from Kimusina Technical and general student. I'm addicted to success, not tobacco.
I'm Hawa Abdullah, a general art student from Kimbu Senior High Technical School. Education, ambition, and good health will take me to places and not tobacco. Thank you.
Hello, lovely people. I am Anita Nanauma Ajemai, a general science student from Kimbu Senior High Technical School. My friends, know this. Every tobacco-free choice you make brings you closer to your goals. Thank you.
My name is Prince Watson. I am a general art student from Kimbu Senior High Technical School. I choose my dreams, my health, and my future over tobacco products. Thank you very much.
Hello everyone, I am Ramzia Adamu, a student of Kimbu Senior High Technical School. Strong minds make healthier choices. I say no to tobacco, vapes and shisha. Thank you.
I am Emmanuel Brady Kofi from Kimusina Technical and general student. I'm addicted to success, not tobacco.
I'm Hawa Abdullah, a general art student from Kimbu Senior High Technical School. Education, ambition, and good health will take me to places and not tobacco. Thank you.
Hello, lovely people. I am Anita Nanauma Ajemai, a general science student from Kimbu Senior High Technical School. My friends, know this. Every tobacco-free choice you make brings you closer to your goals. Thank you.
My My name is Prince Watson. I am a general art student from Kimbu Senior High Technical School. I choose my dreams, my health, and my future over tobacco products. Thank you very much.
Hello everyone, I am Ramzia Adamu, a student of Kimbu Senior High Technical School. Strong minds make healthier choices. I say no to tobacco, vapes and shisha. Thank you.
I am Emmanuel Bedi Kofi from Kimbu Senior Technical and general student. I'm addicted to success, not tobacco.
I'm Hawa Abdullah, a general art student from Kimbu Senior High Technical School. Education, ambition, and good health will take me to places and not tobacco. Thank you.
Hello, lovely people. I am Anita Nanauma Ajemai, a general science student from Kingwu Senior High Technical School. My friends, know this. Every tobacco-free choice you make brings you closer to your goals. Thank you.
My name is Prince Watson. I am a general art student from Kimbu Senior High Technical School. I choose my dreams, my health, and my future over tobacco products. Thank you very much.
Hello everyone, I am Ramzia Adamu, a student of Kimbu Senior High Technical School. Strong minds make healthier choices. I say no to tobacco, vapes and shisha. Thank you.
I am Emmanuel Bedi Kofi from Kimbu Senior Technical and general student. I'm addicted to success, not tobacco.
I'm Hawa Abdullah, a general art student from Kimbu Senior High Technical School. Education, ambition, and good health will take me to places and not tobacco. Thank you.
Hello, lovely people. I am Anita Nanauma Ajemai, a general science student from Kingwu Senior High Technical School. My friends, know this. Every tobacco-free choice you make brings you closer to your goals. Thank you.
My name is Prince Watson. I am a general art student from Kimbu Senior High Technical School. I choose my dreams, my health, and my future over tobacco products. Thank you very much.
Hello everyone, I am Ramzia Adamu, a student of Kimbu Senior High Technical School. Strong minds make healthier choices. I say no to tobacco, vapes and shisha. Thank you.
I am Emmanuel Bedi Kofi from Kimbu Senior Technical and general student. I'm addicted to success, not tobacco.
I'm Hawa Abdullah, a general art student from Kimbu Senior High Technical School. Education, ambition, and good health will take me to places and not tobacco. Thank you.
Hello, lovely people. I am Anita Nanauma Ajemai, a general science student from Kingwu Senior High Technical School. My friends, know this. Every tobacco-free choice you make brings you closer to your goals. Thank you.
My name is Prince Watson. I am a general art student from Kimbu Senior High Technical School. I choose my dreams, my health, and my future over tobacco products. Thank you very much.
Hello everyone, I am Ramzia Adamu, a student of Kimbu Senior High Technical School. Strong minds make healthier choices. I say no to tobacco, vapes and shisha. Thank you.
I am Emmanuel Bedi Kofi from Kimbu Senior Technical and general student. I'm addicted to success, not tobacco.
I'm Hawa Abdullah, a general art student from Kimbu Senior High Technical School. Education, ambition, and good health will take me to places and not tobacco. Thank you.
Hello, lovely people. I am Anita Nanauma Ajemai, a general science student from Kingwu Senior High Technical School. My friends, know this. Every tobacco-free choice you make brings you closer to your goals. Thank you.
My name is Prince Watson. I am a general art student from Kimbu Senior High Technical School. I choose my dreams, my health, and my future over tobacco products. Thank you very much.
Hello everyone, I am Ramzia Adamu, a student of Kimbu Senior High Technical School. Strong minds make healthier choices. I say no to tobacco, vapes and shisha. Thank you.
I am Emmanuel Bedi Kofi from Kimbu Senior Technical and general student. I'm addicted to success, not tobacco.
I'm Abdullah, a general art student from Kimbu Senior High Technical School. Education, ambition, and good health will take me to places.
And now Ajemai, a general science student from Kingwu Senior High Technical School. My friends, know this: free choice you make brings you closer to your goals. Thank you.
My name is Prince Watson. I am a general art student from Kimbu Senior High Technical School. I choose my dreams, my health, and my future over tobacco products. Thank you very much.
Hello everyone, I am Ramzia Adamu, a student of Kimbu Senior High Technical School. Strong minds make healthier choices. I say no to tobacco, vapes and shisha. Thank you.
I am Emmanuel Bedi Kofi from Kimbu Senior Technical and general student. I'm addicted to success, not tobacco.
I'm Hawa Abdullah, a general art student from Kimbu Senior High Technical School. Education, ambition, and good health will take me to places and not tobacco. Thank you.
Hello, lovely people. I am Anita Nanauma Ajemai, a general science student from Kingwu Senior High Technical School. My friends, know this: every tobacco-free choice you make brings you closer to your goals. Thank you.
My name is Prince Watson. I am a general art student from Kimbu Senior High Technical School. I choose my dreams, my health, and my future over tobacco products. Thank you very much.
Hello everyone, I am Ramzia Adamu, a student of Kimbu Senior High Technical School. Strong minds make healthier choices. I say no to tobacco, vapes and shisha. Thank you.
I am Emmanuel Bedi Kofi from Kimbu Senior Technical and general student. I'm addicted to success, not tobacco.
I'm Hawa Abdullah, a general art student from Kimbu Senior High Technical School. Education, ambition, and good health will take me to places and not tobacco. Thank you.
Hello, lovely people. I am Anita Nanauma Ajemai, a general science student from Kingwu Senior High Technical School. My friends, know this: every tobacco-free choice you make brings you closer to your goals. Thank you.
I like the networking ongoing, but please let's be resuming to our seats so we can get enough time at lunch and network.
And my future over to
Head of achievements. Tobacco. Substance.
There are two different things.
Movies.
Movies and so forth. That movies are different. That is also.
Social media. Winston, Franca, and the vast team, can we please help the people out? Thank you. We have just 2 items, and then we come to the second part, in fact, the most important part of the rebate and the outdooring session. Then we will be out of here. I don't want to promise, but I can promise you, politically, in the next 1 hour, 30 minutes, we should be out of here. I didn't say that. Can we? Okay. So as they are making progress and they are making their way in here, I still want to acknowledge some dignitaries with us. And okay, so we have the country coordinator for Guy here, Mr. Stephen Alatige. We have Dr. Alex Combax for the GRA. We have Dr. Martin Kusi from the Tobacco and Substance Abuse at the GRA. We have Professor Axis Singh. We also from the Public Health Unit of the KNUST. And we have the media present. We have reps from BFT, Matco, and Spider. And we have our able Chennai Mukumba, Executive Director of TJNA. We have our very own Labra Musatu here. And we have the representative of the Minister, Dr. Hafiz Adams, representing here. I think I can see is it doctor in the making? Okay, I see Mr. Okansi here. I see George also here, the only ever who has George Wilson Kinson. Yes, he's also here. I can see Tembi here. John, are we good? Okay, thank you very much. Now we can proceed. So we have a 10-minute presentation by the FDA. And to do this for us is Madame Mavis Danso. Please, let's give her a round of applause as she mounts the podium. Thank you very much. Meanwhile, those for the panel discussion should also be putting themselves together. Thank you.
Good afternoon to us all. I bring you greetings from the Food and Drugs Authority. This afternoon, I'm presenting on behalf of my director, Dr. Martin Kusi. The outline that was given to us was basically on the overview of tobacco use burden, WHO FCTC implementation over the years, emerging nicotine products, then taxation as a control tool when it comes to tobacco control. A lot have been said by our speakers and also by Dr. Combat. So look at the overview of tobacco use burden, some prevalence as a country. We are looking at mortality and some economic impact. So tobacco use is a global issue, and as a country is also an issue for us. And once implementation of tobacco control measures are not put in place, this burden will keep on increasing. In Ghana, more than 6,700 people die from tobacco use yearly, and about 668 million cost as annual economic burden when it comes to tobacco use. So these are losses. So every year, Ghana loses 668 million in taking care of tobacco burden diseases. And about this represents about 0.2% of our GDP. 66% of these deaths, 66% of this death also occurs to people under the age of 70, and 18% death from secondhand smoke exposure. Please let me stand this way. So as a cost breakdown, we have about 55% of our income, the income that we have going into tobacco-related diseases. And also, some of the top causes of tobacco-attributed death. When it comes to the death in Ghana, we have ischemic heart disease, lower respiratory infections, chronic respiratory pulmonary disease, tuberculosis. And these are according to Ministry of Health some of the deaths that are attributed to tobacco. Then yearly per person, the tobacco burden per person is 1,541. And if we look, the percentage or the prevalence for tobacco use in Ghana is around 4.8% of the population. So when you multiply this, that is when you'll be getting your 668 million. And the burden per pack is 9.3 Ghana cedis, 9 cedis, 30 pesos. So these are some of the findings from a recent STEP survey that was sponsored by the WHO, and it was also conducted by the Ghana Health Service. Our prevalence for adults ranging from age 18 to 69 is 4.8%. And of this 4.8%, 9.3% males smoke, whilst 0.3% of females smoke. So you realize that there is a gap, or there is a female or gender disparity. So more males smoke than compared to females. Then we have about 62.3% of smokers who have tried to quit. But out of that 62.3% who have tried to quit, it's only 25% of them that sought doctor's advice. So you realize that there is a gap when it comes to the offering of quitting services for these people who want to quit. Then, as I mentioned, there is a gender gap. We have 9.3 compared to 0.3 with female. But when we get to the shisha, we realize that it's the reverse. So for shisha, we have about 44% of females smokers use shisha versus 6.6% of males who use shisha. And the total percentage or prevalence for those who use shisha is 7.8%. So when you look at it, you realize that more females actually use shisha compared to males. And this is because they think that shisha is more safer. That's what they think, but it's not safe. When you smoke 100, a section of shisha is equivalent to you smoking about 100 sticks of cigarettes. Then when you look at the age at which normally they start smoking, we realize that the mean age for the younger adults is around 19 years compared to the age of 28 among those who are smoking now, who are around 60 to 69 years. So which means that the population, or 60 to 68 years, who are smoking now, says that they started smoking when they were 28 years, compared to young people between the age of 18 to 29 years now, who says that they started smoking at the age of 19. So you realize that the old folk were smoking initiation was delayed, but now the uptake of smoking is at an earlier age. Then for secondhand smoke exposure, 19.9% of population are exposed to secondhand smoking, and this is at the workplace or in homes. And we can also say that the male population were more exposed to secondhand smoke, and this is because of the nature of work they do, construction work and other work that makes them exposed. Driving, expatriates, and all these. So it makes the male population more exposed. We want to look at the Tobacco Youth Survey 27. Though this was done in 27, this is the data we have for the youth when it comes to the age 13 to 15. So the one earlier was from 18 to 69 years, but this is the data when it comes to 13 to 15 years. So the prevalence for tobacco use, both for males and females, that's boys and girls, is 8.9%, with 8.9% being boys and 8.2% being females. And current smokers stands at 6.5%. And we have smokeless tobacco also. So you realize that when it also comes to the boys and girls, the boys use they smoke or they use tobacco compared to the girls. But when it comes to shisha also, you realize that shisha smoking is 1.7% amongst girls compared to 0.4% amongst the boys. So which means that as we are all here, once we are putting up policies or we are putting up strategies and awareness creation, we should be targeting the females because they think that the shisha is more safer compared to the cigarette, and they are moving towards that compared to the traditional cigarettes. And also the uptake of e-cigarettes is also on the rise. We have about 4.9% of students currently use electronic cigarettes. So for the WHO FCTC implementation, these are measures that have been put in place to guide countries to be able to adapt their laws and for countries to be able to also implement some recommendations that will reduce the tobacco burden. And the tax we've talked about, they all arrived from some of these recommendations from the WHO FCTC. We want to look at the progression of tobacco control in Ghana. So in 2004, Ghana ratified the WHO Framework Convention on Tobacco Control. Then, based on that, we had the passage of the Public Health Act 2012, Act 851, which had measures that some of it is to ban smoking in public places and other measures that assist in reducing the burden when it comes to tobacco control. Then we had the ratification of the protocol to eliminate illicit trade. Then there was the passage of the tobacco control regulations. Then the enactment of the Excise Duty Amendment Act, as Dr. Combat mentioned. So these are some of the provisions under the Public Health Act: ban of smoking in public places, ban on tobacco advertising, promotion, and sponsorships. There is a section on public education against tobacco use. Then there is a section also on collaborating with other stakeholders in order to implement tobacco control measures. And the FDA, as the institution mandated to regulate these tobacco products in Ghana, and also to ensure that these sections or these portions of the law are implemented. So we want to look at the WHO SCTC Empower and how the country is faring on that. So the Empower, M is for monitor, and in monitoring we are expected to track tobacco use and prevalence. And in this case, we are supposed to conduct surveys and other surveys that will assist us in getting to know the prevalence of the country. And we, as partial when it comes to that, you realize that the case data, the boys and girls data, as at 2017, we don't have any new data. So research is in and here. Then we have Protect. That's once we are progressing smoke-free laws, implementation of smoke-free laws on which the country is doing well. Then Offer cessation services. As I mentioned earlier, a lot of people are not seeking cessation services because they are not available, and that is why it is weak. One, we are doing our best to warn the citizen about the harmful effects of tobacco use. CSOs are helping, and I think all of us in here, one way or the other, are helping in order to ensure that people get to know about the effects of tobacco use. Then enforcing tax, that is tobacco advertising, promotion, and sponsorship. then also raise tax, as Dr. Combat has mentioned. So these are some of the emerging trends that we talked about, these cigarettes that are in vogue now. And these products are marketed as safer. They look very beautiful and like pens, so students are more attracted to them. So some challenges Dr. Combat already mentioned, they are the same with the FDA, cross-border activities, the fact that these products come through unapproved, and the media, they are being used to sell some of these products. Okay, so but I want to say that when you look at this investment case, you realize that tax is one of the measures that is one of the key measures that when used, tobacco control is advanced positively. So all the measures, we use them in addendum or to align with other tax provisions. So we use the increase of taxation, the smoke-free policies, and all these policies, when put together, ensure that the tobacco control measures are implemented and we get success from it. Thank you very much.
Thank you very much, Madam Mavis. So, oh, please, let's do it better for her. I saw when the men came. I saw them when the men came. The way you were clapping. A woman has come. Please, we deserve better. Please give it up for her. Thank you. Yes. Thank you very much. That was very, very insightful. And yes, we all know now that this is the plan of the tobacco industry to deceive younger people now to think that once there is flavor, once it is not cigarette, it is safe. So we really have a lot of work to do. Thank you so much, Mavis. We'll go straight to our panel discussion, and this will be done in the next 30 minutes. We should wrap up in the next 30 minutes. So to help us do or moderate the panel discussion is no other than our own astute tax advocate, who is the Executive Director of Revenue Mobilization Africa. Please, ladies and gentlemen, let's give it up for Mr. Jeffrey Okansi. Yeah. And for the panel, we are going to have reps from the various agencies. So please, if you're a rep, put yourselves together.
Thank you very much, Madam. I'd add my voice to Lady China when she said you have energy. I'm enjoying your energy. And so let me stand on all protocols for the opportunity given me. I think we'll zoom straight and I'll invite my panelists here. And so while we await for the arrangement of the venue for, okay. So yeah, we would like to go ahead and then launch VAST before we jump into the panelists. The project is here. So, okay, so I hear our rep from the ministry who is representing the minister would have to go and attend to a few other. He's agreed to stay. Oh, a round of applause to him. Because I'm sure he would want to listen and then also take a few things that would be sent to for the love of Ghana. So I would invite my panelists here, and I'll start in no specific order, but then also to let you know that I was going to ask Labram. I wanted a fair representation, but it is 3 men and 1 woman. So I'll find my way and also get some feminist voices when I come to the open forum. You have to bear with me on that one. And so from GRA, we have our own Dr. Alex Combact. He's an assistant commissioner with the GRA. Please, let's welcome him with a round of applause, please. And then from FDA, we have Lady Jemima Odonko, head of tobacco and tobacco-related products. She'll join us. We also have from the TGNA, our own brother John Thomi. He's a policy officer with TGNA. Please give him a round of applause. Charlie, my panelists love to be appreciated. Please appreciate them for me. And then from VAST, we have Godfred Kodua.
Head of Research and Policy. So while we wait for Godfrey to join, you all agree with me that from the presentations this morning, we are having to do all we can, but there's a wicked problem that exists, the power of industry. In Lady Chinai's presentation and all the talks around here, we have to go forward by trying to counter a force that exists. These are persons who have some 12 billion annually. That's real cash over there. They have made some inroads with their movie scenes, and these are areas that they are exploring that it will be difficult to clamp them down. How difficult it is, how do you tell people to stop it, is what we are going to be discussing this morning. How we are going to be countering a lot of things that they have been doing and trying to stop their interference. So my first question will go to Vast. And Kofred, you'd like to help us. The Ghana National Health Insurance Scheme faces chronic underfunding. To what extent should health tax revenues be explicitly linked to plugging health financing gap, and how do we avoid creating a perverse dependency? So if you can help us, Kofred.
Thank you, Mr. Vacancy. And I'd like to thank all stakeholders here for your contribution to our advocacy for ACX. When it comes to healthcare financing, I think over the years, past regulations of the government and of material and doing several meetings where we understand the nature of this. We all use healthcare facilities. We do understand the challenges we face, and most of the times we are more prone to actually blame government or even blame various institutions like the NHIF for not actually doing their work. But what actually analyzed these things we are not just looking at the finance that's war, we need to look at sustainable financing. We all here, I think currently there's a 10 going on that we all need money, but at the end of the day, more money is better, right? So if you are going to have money today, you are going to have money tomorrow, is that a good thing, or you want to have money throughout continuously? Global evidence has told us that there is a way to have sustainable financing. Sometimes it should be as simple as it should be, but there are other areas that actually prevent us from achieving this. There needs to be a political will to be able to say that this is what the evidence says. Why don't we go with the evidence? Health taxes are one of the ways that we can sustainably fund our healthcare system. We now currently have the Ghana Medical Trust Fund, we have our NHIS, we are developing some of these things. How do we transfer these things in there? We were recently at the fourth African System Summit in Alisa Hotel here, and we have a running with some of the industry players here. And during the discussion, one of the things they brought out was that if government truly believes that these products are as serious as government want to claim, and government wants to tax it, from the industry perspective, the lack of government commitment to earmark some of these taxes to actually solve the issue tells the industry that the government is not really fully committed as it should to actually address some of the issues. Because when you go to the industry, whenever there is a problem, you allocate all the resources to address it. But if you allocate some, but not all, so they were quite surprised when they came to the Ghana Medical Trust Fund and they didn't see any allocation for the health that's going to the fund. They were very surprised. So it tells us that there is the evidence. If the industry believes that the evidence is real, but what you see at this point is I don't have the political government to actually make sure that we have the sources for of really the government that is really or I started to actually the streets and then for one day natural this. So I think the current elements we are in, how do we move that evidence forward? How do we make sure that government take the short stand so that even the industry on all public concerns are actually not as fine. Government is allocated everything it has, all the resources what is the current evidence to actually address the issue we are facing right now?
Thank you, Godfrey. I'll move straight to Dr. Combat. Doc, health harmful products and ultra processed foods, that's the UPFs, are increasingly on the health tax agenda. What would credible, enforceable tax look like in Ghana, specific? And which institutional actors would need to be aligned to make it happen for this country?
Okay, thank you very much. So, GRA is committed to implementing taxes when it comes to harmful products. So, as you just mentioned, this will be one of the products that are actually harmful. And if we decide to implement tax to discourage consumption, I would have always advocated that when the tax is being implemented or introduced, it should be based on the harmful effect of the product. For instance, if you take alcohol or the alcoholic beverages, so the tax should be based on alcoholic content. If you take sugar sweetened beverages, the tax should be based on sugar content. If we take a product that are fatty, then the tax should be based on the fat content. If it is salt content, and this can actually help discourage consumption of the product. And even the producers getting to know that if you reduce the content of these harmful constituents, then they are going to enjoy lower tax. The taxes will be lower, and that can help reduce the harmful effects of the products. Thank you.
Thank you very much. Let me go to FDA just next to you. Your lady, please help us. When Madam China was presenting, she said we need to generate evidence. So now, right from reducing consumption, I want to go to evidence to back our case and make a case for ourselves. Now, when you look at the evidence from Kenya, Nigeria, South Africa, it shows that illicit trade is driven by enforcement gaps, not tax levels, and that industry has itself facilitated smuggling. How should Ghana decisively counter illicit trade argument when it resurfaces in the 2026 reform debate? Help us.
Thank you very much, Mr. Moderator. So in Ghana, illicit trade in tobacco is one of the key factors that affect regulations. As regulators of tobacco and tobacco products in Ghana, our task is to ensure that the products that comes in or that is put out there on our markets are actually what has been approved by the authority. Unfortunately, due to the porous nature of our borders, we find most of these products coming in without going through the needed approvals or going through the right processes for the necessary revenues to be generated or for the products to be taxed. So as a country, yes, we are doing all we can to ensure that the level of illicit tobacco products on our markets is reduced drastically. That is done through series of activities. So we carry out a lot of surveillance on our markets to ensure or to clear the market of illicit tobacco products. And if you are fined or you happen to be caught in the web of importing these products, we apply the necessary sanctions to serve as deterrents for others. So yes, we are doing our best, but still there's a lot more work when it comes to the level of illicit tobacco products on our market. So yes, that's all I can say for now.
Yes, pass to the next gentleman. Setomi, you are leading the crusade. There should be somebody to organize the other organizers. As TGNA, how is the continent doing with regards excise tax reforms? What challenges exist and how is TGNA helping to address these gaps? Walk us through that one.
Okay. I'll start by at a continental level. I'll say we are doing pretty well. And even when you look at the scores at a global level, the African continent is really trying, and in terms of putting measures at a broader tobacco control, we are doing so well. So recently we saw Zambia enacting the tobacco control bill, which will finally be an act, hopefully. And now narrowing down to taxation. And as TGNA, we look at these through the regional economic communities or blocks. Fortunate enough, Ghana sits in one of the most progressive economic community, and that is the ECOWAS, which prescribes through the laws that they have on the best structure. And you could see from the numbers that indeed, if you implement it to the letter, you'd have very good progress. Moving to East Africa and the southern part of Africa, some progress is being done, and our interest is now on harmonization. Because if you have a harmonized rate across the region, then cases of illicit trade would be reduced, because the incentive for you to be involved in illicit trade would not be there. So as a continent, in terms of progressivity, there is hope, but also there is a bit of challenge, and that probably goes more to the revenue authorities, because illicit trade is more of an administrative challenge. And most of the African countries already have policies that are good enough, are strong enough, but their enforcement becomes a challenge. So as TGNA, we continuously try to support the revenue authorities and the civil societies and other players through evidence generation. So for instance, last year, but one, we did an analysis in Kenya, and the report is called The Missing Millions, whereby we assessed what the industry filed as their audited reports against the actual occurrences. And we realized that through tax abuses and such, then the government was losing a lot of revenue. So it's a matter of us trying as much as we can as Tax Justice Network to assess the narratives that the industry is pushing, because again, due to that gap that exists between research and what the government is consuming, there is more of industry narrative being pushed to the extent that they are perceived as sources of reliable information, which is not or should not be the case. Yeah, thank you.
Yes, that's another exposure of it, the wicked problem. Industry taking a leap ahead of us every time, trying to misconstrue the truth that we have. And, ironically, they're doing this using legal means to do illegal things. I mean, in Ghana, there was a snippet of a smartness when Labram and myself had to counter some of the inputs that industry would want to make through available spaces. So let's go forward and look at the administration. But hey, the truth is, let me appreciate TJNA once again for information spread. I am a humble, confused PhD student, but most of my, don't go and tell anybody I go and steal the information. But when you get to the TGNA page, Madam Chinai, please, even though you are busy, please listen. Whoever is managing your communication, increase the person's salary. The gentleman is doing well. Because anytime I go there, I meet information that is good for my term paper. So I want us to appreciate the information. That is how I'm linking it to what he's saying. If there's misinformation and disinformation out there, you need to counter with consistent information sharing. That is the best we can do for ourselves. Now let me go to the administrators, FDA and GRA. Ghana's tobacco excise revenue grew by 305% in 3 years, directly contradicting every industry projection made in 2022. What does this tell us about how government should treat future industry submissions during 2026 reform cycle? I'll start with FDA, since you have the microphone.
Thank you very much. So, going forward, when it comes to tobacco taxation, as we all know, taxation has been one of the measures that has been put in play or that can reduce the availability of these products. So, when it comes to tobacco taxation, I think the country is doing quite well, but there is more room for improvement. So the taxes can be relooked at. Currently, we have a very critical issue on hand. Whereas when it comes to the use of E6 and then vapes, these are banned products in Ghana. But if you look at our data, these are taxable products by the GRA. So what happens is that when these products are taxed and they are let out onto the market, FDA comes in to seize or take out these products and then sanction. So if we can look at taxation again in reference to these synthetic tobacco products, I think it will go a long way because per the country's law, these products are not supposed to be on our markets. What we can do as a country is to probably expand the taxation or look at higher taxes on the already existing tobacco product because with what we have now, yes, the initial aim is to make it a bit more expensive so that its availability or accessibility will be reduced. However, with time, the system is becoming used to the level of taxation on the product as we have it. So purchasing or having access to the product is becoming much more easier because the system is getting used to the level of taxation on it. So if we can look at a system whereby the taxes can be related to or can be matched with inflation. So as inflation increases or decreases, then we have the taxation also running in that same way so that the availability of the products will be or may be reduced or maybe it may not be easily accessible, especially to our young ones.
Thank you. I think you passed on to Doc.
Thank you very much. So during my presentation, I mentioned 4 wins when it comes to implementation of the excise taxes. So one of the important wins was revenue. And then the other one, the second one was to reduce consumption of the products. So whilst we use the market solution to reduce the consumption, the revenue aspect is inevitable because so far as you implement the policy, the tax, the revenue is likely to be generated. Now, the problem is, do we actually use the revenue to support health programs related to consumption of these products? And that is big no. And so what your question based on the fact that we're going to have another budget 2027. So I would have advocated, when it comes to ring fencing revenue, it becomes difficult because GRA is mandated. When you look at our law, the 791, when you look at the section 3, it mandates us to collect the taxes and pay the taxes into the consolidated fund. So irrespective of the revenue accrued, it goes directly into the consolidated fund. So what we can do here will be taking into consideration the 2-tier policy making. When I say 2-tier policy making, I'm talking about actually coming out with a law that ring fences the revenue. That is the first tier. And then the second tier will be, okay, you've ring fenced the revenue. What next? The second one will be to have LI that can actually pull the revenue from the consolidated fund for health programs. So as we go into 2027, and I remember when Labram was at a stakeholder meeting, he was asked to present a paper. And I could see in the paper the ring fencing. He sent it to me to submit. And I could see in the paper ring fencing. So this is what everybody, including the CSOs, everybody, this is what we should be advocating. that government can actually have a law that says we are ring fencing the revenue from these taxes. And then we can have LI, as soon as it is ring fenced in the law, then we can have LI to pull it, and then it can be used for help programs. Because when you look at the medical trust fund, I mean, taking care of NCDs and all that, they don't actually have a dedicated fund. And when we're able to pool the funds from excise taxes, we're able to support such health programs. So this is an appeal to everybody. Let's advocate and see how government can respond to our advocacy so that we can get some funds ring fenced or dedicated for health programs.
Okay.
Thank you.
Thank you. Let me go to Godfred. Godfred, Doc has taken a leap into your presentation already on that question, but vast Ghana recommends ring fencing as a share of tobacco excise revenue for NCD prevention. You want to give us just a snippet to add to what he said?
Yes, I think looking we should also be looking beyond ring fencing just for looking at beyond the preventive side of things, because one key thing is that when we look at within our tobacco control strategy, we have tobacco control fund, which over the years has not been actually been activated or actualized. So we have the FDA here who are going through all these regulation challenges, but where's the fund coming from? I think recently we are even having discussions around some of these 30% of the funds that, which is within the law, that 30% of all the fines that come from the enforcing tobacco control laws should be used for tobacco control activities. But the question is, where's the funds? Because we've had several engagements with the FDA, and then we have now become aware of that some of these funds are not even going there. So it brings the question back to the fact that we are trying to address an issue, we are trying to target an issue, but it seems that we are also crumbling ourselves because the things we need to address it seems that we are not moving the funds where we need to be. And government may actually say that they have other priorities that government needs to put money in it. And that is why as a society, we have always been pushing for sustainable funding, that health taxes should be used in some of these areas. Because if we are using health taxes in these areas, it doesn't actually move more of government priorities into other areas. So it's a very big win for the government. And that is why we keep pushing, and that's why we keep advocating for that as well.
I'm sure Doc from the Ministry of Health, Doc, I'm sure he wanted to talk to you, and he was talking to me, but Doc heard him. Me, I don't like gossip, you know. He was trying to tell you that you should tell finance minister, that money, 30%, we should shoot it straight to that one. So Doc heard you. I mean, you should have mentioned Doc's name. Doc is a friendly person. So TJL, big brother, listen. Here we are. All the good things about what we want to do is still on the table. The Institute for Liberty and Policy Innovations, ILAP, convened GRA, FDA, and security agencies, officials around industry-aligned messaging and illicit trade. How should government and civil society identify and manage the influence of industry-aligned organizations operating in Ghana's policy space? I'm sure you've heard about them even in other countries. What advice would you want to give to us? Thank you.
Okay. One of the things that to me appears very critical, because when it comes to government, there is always a bit of disconnect in terms of how they treat the tobacco industry. So on one hand, we leave what we call Article 5.3 as a Ministry of Health concern, yet it is supposed to be applied to the whole of government. And so the Ministry of Finance will treat tobacco industry with some pairs of nice white gloves, soft and all that. But every information that comes from the tobacco industry, to me, should be treated with independent verification standards. That is rule number one. Number two, the rules of engagement with tobacco industry should be very clear, and there is total need and buy-in from each and every government institution. Number three now comes to continuous monitoring, because the civil societies play a very good role when it comes to monitoring of the industry. But even if you monitor and you have enough evidence, you call out, but there is no goodwill or action to act on whatever evidence you are presenting, then at the end of the day, the effects and the impacts that come from their activities would continuously be felt. So we should not tire from monitoring. We should not tire from raising concern and publishing the evidence and all that. But also from the government, we hope that they would have that goodwill to fight and safeguard the resources that we have. So just as an example, is that continuous advocacy, for instance, in Nigeria, in Kenya, has helped actually to stop some of the actions that could have affected the whole public. So it is a continuous process. Sometimes it appears to be in vain, but it is progressively achievable, and the fruits will be seen continuously. Yeah.
I am so much in love with the continuous process. We need to still keep on fighting like the going concept in business. I mean, we are in business, we should continue with that one. But we always have to be alerted by the fact that I told you, the industry usually sometimes and every day would be using legally available spaces, using academics and getting CSOs to make their case for them. For example, if you wanted to pass anything, any policy on tobacco, you would have to open it up to the health committee, and any other professor or CSO who actually advocate for industry can submit a paper indirectly on behalf of industry. So this is how the competition is. So panelists, I'll come for your final commentary in a bit, but I'll go to the forum for the open forum, and then we match both together. But to lead us there, I would like to go a little bit on gender, and so I'll call one academic, Professor Singh for Public Health Department of NUST, and please, Prof, can you please help me with the microphone to Prof, and then she'll just give us the, oh, please, thank you. Tommy, thank you so much for that. Sorry for the inconvenience. And yeah, Professor Singh, there's a gender aspect of all this discussion.
Okay, yeah, thank you
Gender
so much.
scare. I want to have a morning gender scare.
Okay. Okay, yeah. Thank you, and it's a pleasure being here and then giving the opportunity to speak on gender. And I think when it comes to tobacco use, it's quite clear that we do have a male predominance in terms of tobacco use. But I think the problem now is the industry coming in with new products, and some of the studies that have been done in adults still show that males smoke more than women. But when it comes to new products like shisha and nicotine pouches and some of these other very fancy electronic cigarette products, the trend is actually changing, and it's happening not only in high income countries, but also in low and middle income countries, including sub-Saharan Africa. And I think we also have evidence from our 2017 Global Youth Tobacco Survey that shows that young girls smoke shisha more than young boys. So the trend is already changing when it comes to the gender imbalance when it comes to these new products. So I think, back to our panelists again, the industry is really trying hard to reduce that gender gap between male and females. But we know that once women start spiking in terms of tobacco use, there is a big problem then, because then it goes to affect several generations down the line, because we are looking at low birth weight. We are looking at all the complications that come in when you actually get some of these pregnancy-related issues when women start to smoke more. And then it becomes a huge socio-developmental issue. So I think that is where we need to really understand that we need to keep the gender the way it is. At least the adult smoking rate, it's actually coming down. I think it's just about 4.8% in overall prevalence. But we need to be careful with newer products, and that is where I think we need to look at the industry interference in policy making, And I think several of our panelists have also talked about that. So making policy really, really strong when it comes to industry interference still is the catch here when you look at these new products, emerging products coming up. Yeah.
They're still on my efforts to make my gender balance. Can we pass the microphone to Lady Angela Alu? Dr. Alu, please help us. Add your voice to the tax revenue earmarking. If you have any advice for us, we want to hear from you.
Okay, thank you very much. So I want to add my voice to the call that Dr. Combat made. He's such an advocate for us in the civil society space that it's very important that the revenue is not just collected, but as he's already suggested that we advocate more for the ring fencing as well as like the specific earmarking for health sector financing. So it doesn't just go into the bottomless pool of the consolidated fund. Thank you.
But let me ask you this. You see, I keep telling advocates every day, in a minute, I've been telling Labram every day, in a minute, if you meet the minister and you have the opportunity to meet the president, you should be able to make a call.
Yeah.
See, so what percentage do you want? Is it 5% of the total revenue collected, 2% of the total revenue collected? Because see, if you make it vague, it means another committee to be formed to determine what you want. And that makes it difficult for Doc to go around the table. So if he's going, this is your uncle, your father is out there. What do you want?
Please, if we had our own way, it should be 50%.
Okay, so now, Doc, it looks a difficult task, but let's start from 50. If we end at 5, that will be fine. So I'll take 5 more contributions from the floor, and then I'll come back to my panelists. So let's start with you.
Thank you very much. And
identify yourself, please.
Solomon, thank you so much. I would want to direct my question to John. We've heard so much about the effect of tobacco, then the aggressive, strategy or tactics by the industry. These are products we know or we have classified to be harmful. My basic question is, if, for instance, having come to understand all of these, facts, is CGN in a position to help me hire a lawyer to sue the industry? Or has there been a situation where an individual, in Africa, not in the developed world, has sued the industry and has won before? Because these products are bad, we know. We keep talking about how bad they are, but nobody is ready to challenge, the industry.
Okay.
Thank you.
So you're looking at maybe legal reforms if TJN has any support for that.
Yeah.
Right.
All right. My name is Derek Kwame, the project officer for Media Alliance in Tobacco Control and Health. So the tobacco industry and people that front for them normally uses the media. And the fact is that they engage the media to talk about why there shouldn't be some increment in taxes and all that. And they do this so much in the media that sometimes it becomes important for our chairman here to engage some of these media houses. But the fact is that they say, hey, chairman, we have to pay all the salaries you see here, we pay. The electricity bill, everything here is paid for. And industry has got so much money and they pump money into this advocacy for them. And we don't have resources to even engage these senior gatekeepers to be able to see public health as the main issue here and not money. So I want to ask TG and A whether in this particular project there's a component for media engagement, especially the gatekeepers, so that they now patronize and prioritize health care and public health over the money or the financial gains that they get in these engagements. Very important.
Okay, you are looking at new shaping, the editors, the final deciders.
Right. Thank you very much. This is a very important subject matter. My name is Sampum Isaac, a member of the vast movement. I call it movement. And I belong to one of the known civil societies in Ghana, the Ghana Coalition of NGOs in Health, and also from Concern Health. Now, Africa is promoting free trade. Africa is expanding trade. how are we going to engage the business actors, those we are calling the lobbyists, in the framework of a win-win engagement, such that they will be conscious of either using a good product, if it's sugar sweetening, a good product in developing their product as against killing us softly. And so, what would be the advocacy approach on a level playing field promoting trade? My MC, I hope you got my question.
I got you right. I think we are looking at the trade entanglements and how we can free ourselves from those ones. I've not heard any female voice again. Be controlling my microphone.
Should I give it to the female first?
Okay, yeah. Yeah.
Okay, my name is Sarah Fori from GTV. I noticed that a lot of, let's say, musicians or persons in the creative art industry, so I noticed that a lot of people in the creative art industry project smoking as a status symbol. Let's say in their music clips, in the movies they act, they project smoking, and especially these alternative forms of smoking, as a status symbol. Have we targeted it from there, whereby we had the FDA banning the creative art industry from advertising alcoholic beverages? Can we also scrutinize their products, or in terms of let's say their music videos, their movies, where they project people smoking? Can we have a conversation on that? Because this is where the youth are learning from. They see it as a success or status symbol, and they learn, and before we know, it's gotten out of hand.
Because if I think we added it to, I added these ones to the wicked problem. Those are the sick problems you want to fight. I mean, the movies. So I mean, I'm sure one of them will help us with that.
Yeah,
There's a
thank you very
final
much.
question.
Yeah, my question goes to Dr. Combat. I was much excited when you mentioned this specific taxation on these harmful products, i.e., being salts, trans fats, and the rest. My question is, how do we start this advocacy to get it implemented? Because as you really mentioned, these are the key agents, of course, that connect and lead to NCDs, which is becoming a very worrisome. And there is influx into our market. And as it stands now, nobody knows the amount of grams that one requires to use in terms of added salt when preparing food. So I think if we have this strategy in the taxation, I believe that, of course, it will go a long way to also help to improve, of course, what we expect. So what are some of the strategies that you think that, of course, as CSO, we can employ to advance advocacy? And lastly, my issue, the next question to FDA. You mentioned porous borders. I think that has been the term always, porous, but we have men around our borders. Do you have this incentive for them? Because we do believe strongly that some of them do connive to have these products straight arriving in our countries. Do you have incentive to encourage them to do the work, or it's just like they are doing their own thing? Thank you.
Thank you so much for the forum. And now I'll go to my panelists for the final round. And so each panelist will be served with one of the questions from the floor. And I'll start with the GRA. The GRA, I think you will have to help us with the trade entanglements that he mentioned.
Okay, so the first one got to do with the after. Please, the after will not help when it comes to control of importation of these harmful products. After got to do with free trade, and therefore they expect that there will not be taxes on importation and even production of these products. Let me give you this typical example. Then you appreciate what I'm talking about. Now, we are all aware that tobacco is harmful, right? Unfortunately, tobacco is not produced in Ghana. It is produced in Nigeria. Did you know that when we import tobacco from Nigeria, it is duty-free?
Wow.
If you import tobacco from Nigeria, it is duty-free. If you import tobacco from Vietnam, it is not duty-free. The difference is that they are trying to promote continental trade. And so you see, even this harmful product is not attracting tax. So if it is extended to the entire continent, and then you have countries producing these harmful products, they will tell you that because the products are produced, in Africa, when they are when they are importing them, there should be no tax. And the clear case is the tobacco. There's no tax on tobacco when you import it from Nigeria. And when I made a presentation, you saw the volume, the quantities that are coming from Nigeria, but there's no tax on the tobacco.
Okay.
So that is the problem. If you try to promote after, there will be no taxes on these sample products, and they will flock the country. They will come in their numbers because whatever is produced locally, they are also produced outside. And they are allowed to import them because we have free continental trade. So after will not help when it comes to consumption of these sample products. And then the second one, you were talking about strategies, right? Please, this is an opportunity for all of us here. The greatest opportunity for all of us here. You know, the Act 878, that is the Excise Duty Act. There was an amendment, but that particular amendment touched on only the fair schedule. And the fair schedule, they review the rates.
Right.
You know what is happening now? Minister of Finance, Dr. Atuforsen, has charged us to review the entire act from section 1 to the last section. To review, to overhaul the entire act. This time it is not about one section, it's not about the first schedule. It is about the entire, act from section 1 to the last section.
Okay, wrap up.
We are reviewing it.
Right.
And so this is an opportunity for all of us. Mr. Labram has presented a proposal.
Right.
All of us, if you have proposal on how we can change things to get the act being better, please send it to me. I will just forward it to the ministry.
I hope
we shall
that
meet and then incorporate your inputs.
Right.
So that is the strategy for you.
I hope
you.
under this project, VAST will take advantage and will take an activity that will bring all of us together to address this one. For FD, your last comment, please. The porous borders and then the scenes, the movie scenes, that wicked problem.
Thank you very much. So let me start with the depiction of tobacco use on movies and then on our social media platform. So when it comes to depiction of tobacco in movies, if under the tobacco control regulations (LI), there is a section on depiction of tobacco in entertainment media. And per that section, the law requires that if a producer or a movie industry is showcasing the content with images of tobacco or the use of tobacco or any tobacco product in there, the responsibility lies on the producer to run an anti-tobacco messages alongside the movie. But when you look at the situation on hand, you don't find some of these things happening. You don't find most of the industries or the movie producers running the anti-tobacco messages alongside such depictions or such movies. So currently, that is a gap we have identified as an authority. Currently, and finally, for us as a country, we are running a project, and that project is focusing on some of these areas. That is enhancement of tax ban in Ghana. If you know, the law bans any form of tobacco advertisement, promotion, and sponsorship. So with this, thank you. So noticing this as one of the gaps or challenges in the enforcement of tobacco control regulations in Ghana, this project, as we have started, is going to take care of some of these lapses. So we've started with development of guidelines, and the guidelines would inculcate some of these non-compliances, as you have observed in the media space. Now, when it comes to the issue of porous borders, yes, your question was that don't we have men, women at these borders to man the borders in order for the yes, we have officers and men across the country where we have border posts. But when it comes to the industry taxes, they have different ways and means of trying to outwit the system. You find large volumes of consignments coming in, and it's not always feasible for an officer to go through everything that passes through the borders. Some of these products are concealed in the things that comes in, so it makes it much more difficult for officers to detect as these products come in. Yes, there may be one or two officers who may compromise their stance in there, but I can assure you we are doing all we can as an authority to prevent these things from coming in onto our markets.
Okay.
Thank you.
Thank you so very well. TGNA, Big Brother, three things went to you. We're looking at the availability of funding for legal reforms, also how to actually do some work around the issue of media. And then finally, they're also asking from you how we could shape policies, with this trade, on the table. It becomes a bit technical, but I'm sure you've done some engagements already. You want to tell us something?
Okay. So on the media engagement, so this is a bit on program design or the project design. So specifically for the health tax project, what we do is that we allow our national partner to design how to implement the project on their own. Because remember, I emphasized on country-specific solutions. At TGNA level, because we again run a lot of other programs under the 4 pillars that we have. We do have capacity building for journalists, which takes place on an annual basis. Actually, there is one that is ongoing currently, and it touches on all the 4 areas or the 4 thematic areas, including health taxation and how to address industry interference, how can journalists support and all that. So there are those 2 levels, and it will depend with how vast we would want to engage with journalists. But at TGNA level, that's what we do. So based on how resources are available, we try as much as we can to have a representation of journalists across the continent. On effect of tobacco and if TGNA can be able to sue. So specifically for tobacco, our area of interest and strength is on taxation, because the institution as it is formed is strong on taxation matters. So we have been able to do some litigations on taxation agreements, double taxation agreements, that we felt to some extent facilitate leakage in terms of revenue for the different governments. When it comes to individual level and the effects that tobacco as a product causes. Most of the time, and if you look at now other jurisdictions that have successfully done or gone through the litigation and probably won, you realize that the evidence takes time to build. And it's most of the time pegged on health effects. You should be able to justify and undergo that whole process. So as TGNA, we might not be able at the moment to support that process simply because of resources and also the way the project is formulated. However, if need be, on other areas, economic justice, tax, and such, based on the evidence that we have, we can be able to support such processes. The last one was, I've answered two.
Yes, so the final one was actually around the ECOWAS protocols,
Oh,
the trade issues. Actually.
So on the protocol, I know there are some discussions ongoing, especially for the continental free trade area. We have an ongoing analysis, although not done by TGNA. I know of a consultant who is tasked to analyze and see how policies that safeguard against harmful products can be onboarded into the protocol. So we are waiting for that report to be out. The best, to my knowledge, the information that I have is that the work is already done. It's under validation. So we are waiting to see the recommendations that will come from it. But definitely it's something that will be interested. Because just one more minute to give an example. We did an analysis for Zambia, and we realized that Zambia, in order to attract more investors, they set a preferential treatment for industries that were established within Zambia without an exception of tobacco industry. And through that, our analysis showed that within a short period of time, around 3 years, they had lost a lot of revenue. And the question that we were directing to the government, is there any better tobacco product, whether produced at home or imported? Because they were doing a preferential treatment of local industry against imported products. So those are some of the questions that we will be posing and probably proposing better policies when it comes to the deliberations and going forward based on the recommendations.
Thank you very much. Final to Godfrey Vast in a minute. Please help me.
So
The
let me just
strategy
step
and then
into
your
the
quick comments.
industry. So over the past years, Ghana has conducted industry monitoring, the index reports. The last two ones, we identified some subtle key things that the industry is doing, using funding from ASLA's network to fund organizations within our academic institutions to push students, build a network of students to push for this free trade policies. And one key thing you see within their reporting is that they want an Africa where, especially when it comes to health taxes, that government should do some of these things. These are some of the subtle ways the industry is pushing when it comes to this trade agreement and this trade policy. So I think moving forward, these are one of the ways we need to be able to do, because the industry is smart. They are using various avenues, even going through students, because those are the ones who are becoming the next leaders, so that they're actually able to push for some of these things. Now, as we are pushing on this tax advocacy project, it is very, very key and consequential to look back to what happened during our last advocacy for these tax changes. During the debate on the floor of Parliament, whoever watched that video, it was heartbreaking. When you look at the argument most members of Parliament made on the floor of Parliament, it was as if the industry has written them a script. And then it made us understand that when it comes to some policymakers' understanding about health access was limited. So it is very key that in our advocacy, we need to be able to really let them understand why health access are very important, because we got to understand that most of them had no idea why we were even calling for that. And it got to a point, most of them were even advocating for more products to the Ghanaian youth as well. So I think we need to actually look beyond that.
Okay.
And I also need to emphasize the point that if our tax systems are designed right, no matter the argument the industry is going to make, it will never make a stand. So we need to actually make it as a key. And when it comes to the code of conduct, I think it has been long overdue, and we need a code of conduct now. And as Ghana Civil Society, we are ready to support and give government and collaborate with government to actually get it done, because we need it done and we need it done.
Are you speaking directly to director? Director, he was talking about the code of conduct. I told you this gentleman, he tries to use me, but I mean, you want to re-echo that one?
Yes, because yes.
You want to re-echo that one? Prophet, you want to say that again?
Yes, because it's been over 10 years since the Public Health Act went into effect, with key sections that we need to have a code of conduct. The industry has been playing us left and right for a long time. We need to make it happen. And as Ghana Civil Society, we are ready to collaborate with government to make sure that some of these key aspects of the law is being implemented. Thank you.
Okay, so I have to just break your protocol for just 10 seconds. Dr. Aifa, you want to say something? He's a researcher and he's also with the University of Ghana.
Thank you. As we bring the discussion to a close, sorry, I was outside, but I just to sort of find out if we try to also hinge on illicit tobacco.
Yes, we did.
Because we are here talking about using excise taxation as a good vehicle to stop consumption. Because when you do that, obviously, it's going to reduce or disintensify people from purchasing. But if I remember some time ago, VAS did some work. I was involved. And we realized that in terms of illicit tobacco, the Ministry of Finance has estimated between 20 to 30% of tobacco that comes to our country. The popular tax stamp and all, we didn't have that. And so even as we are discussing this, if it hasn't been highlighted, I think that we should also look at how we control the illicit ones that come in, because that will naturally or normally will not go through the system for us to have the excise tax that we are all talking about. So that is something that unfortunately the ministry in charge, I'm not sure it's only GRA.
Right.
But it should be a concerted effort so that at our borders, we need the immigration need. Of course, the GRA arm that also takes care of that is there, but we should be specific and intentional about looking at bringing in tobacco product that does not pass through the formal channels.
Thank you, Doc. I think FDA has said, but then it's good that you have added. Finally, it's actually an honor to be here with all of you, my panelists, and then my good contributors on the participants front. We had Dr. Alex Combat, Assistant Commissioner from the GRA, joining the panel to discuss with us. Can you please appreciate it for me? Let's also appreciate our lady Jemima Odonko, Head of Tobacco and Tobacco-related Products from the FDA. Please give it to her. It is important to also appreciate Godfrey Kudya, Research and Policy Head from VAST Ghana. Please do it for him. And former Big Brother institution, the TJNA, John Thomi, is a policy officer from there. We need to appreciate him. My name is Jeffrey Kabutokas Jr., your host for this moment. And now let me tell you what. Thank you all for making inputs to my PhD term paper. You are so wonderful people. And with your kind permission, I'll use the information. Thank you. God bless the land we are standing on, and God bless our homeland, Ghana. Thank you. And thanks to all of you. I appreciate my panelists when they are taking their seats. Thank you. God bless all of you.
Thank you so much, Jeffrey, Mr. Okansi. Thank you so much. I need to charge you for the extra time. I need to charge you for the extra time. Okay. Thank you to the panelists. I must say that your insights are, your submissions are very insightful in advancing both policy advocacy and behavior change communication. Please, one more time, let's give it up to them. I'll call my co-moderator, and he has a very important assignment to do. Please clap for him.
Thank you so much, my co-moderator. Viva Vast Viva.
Viva.
Viva Tax Justice Viva.
Viva.
Viva Tobacco Taxation Viva. Viva, viva, viva. Thank you very much for this particular. Amandla. Thank you very much. Thank you so much. So for this particular session, we need a lot of energy. I think it's the main meat of why we are here, both for the launch of the project and the launch for Vast Ghana. So I'm going to lead us off during the launch for this particular project and have the absolute pleasure of inviting Dr. Hafez Adam to just make some slight contribution, some slight remarks on this particular. Let us welcome him. Thank you very much.
Thank you. Thank you very much. I think that the program has a value in a manner that I can make just a simple statement, and seeing and hearing what the presentations and speakers and the moderation and all the contributions, I think that I cannot just say it in 2 lines. In fact, I had prepared to, as I was sitting there jotting and I was making notes. And initially I thought that the closing remark with the lunch would be about 10 pages. But because of some other exigencies, I've reduced it to just 10 paragraphs. Well, it's still long. So, distinguished participants, our guest, today marks an important milestone in Ghana's journey towards healthier lives and more sustainable health financing. It is therefore my greatest pleasure and honor on behalf of the Minister of Health to officially announce the launch of Phase 3 of Tobacco Tax Advocacy Project in Ghana. I believe the club is not signifying that I have launched it. I just said that the announce. So this is timely initiative that comes at a critical moment as Ghana, like many other countries, are grappling with the growing burden of non-communicable diseases. The project seeks to strengthen the advocacy for effective health taxes, particularly excise taxes in health-harming products such as tobacco, alcohol, sugar, sweetened beverages. So as we have heard from previous speakers, the vision and mission behind this initiative is both simple and compelling. One is to create a win-win outcome for public health and national development by reducing the consumption of products that contribute to disease and premature deaths, while at the same time generating additional domestic resources to be able to address the menace of tobacco and other products that are impacting negatively on our health. So the Ministry of Health firmly believes that prevention is one of the smartest investments any nation can take. The rising burden of chronic diseases places enormous pressure on families, communities, and our healthcare system. We are therefore encouraged by what I have seen today, the contributions and everything, that this project will focus on advancing evidence-based policy advocacy, generating high-quality research, fostering strong multi-sectoral partnerships to support informed decisions. Ladies and gentlemen, we are also encouraged by ongoing discussions on how revenues can be generated, because all what we are doing, the beautiful plans that we have, including the Ministry of Health, if we are to undertake them, we need money. That's why it's so important that we expand the scope of the areas that we can marshal up
as far as funding is concerned. And so it's so critical that the interventions, including efforts to expand access to quality primary healthcare services, such investments have the potential to improve health outcomes while advancing our national commitment to UHC, that's the universal health coverage. I would like to express my gratitude and our sincere appreciation to the Tax Justice Network Africa. So at this point, can you join me here, please? Laurent, also join me here, because your leadership and your unwavering commitment to promoting public health through progressive tax policies. We are equally grateful to VAS Ghana and all partners who have dedicated and continue to dedicate and drive meaningful policy dialogue and reforms. We hope that this collaboration will not only strengthen tobacco taxation and tobacco control effort, but also generate value, evidence, and advocacy for addressing other health-harming products, including alcohol and sugar-sweetened beverages, which are increasingly contributing to the burden of non-communicable diseases in Ghana. At this point, ladies and gentlemen, the success of this initiative will depend largely on our collective commitment, partnerships, and determination to place the health and well-being of our nation at the center of our policy level in Ghana and everywhere in Ghana. And so it gives me the pleasure at this point, with the greatest optimism and confidence, that I officially declare phase 3 of the tobacco tax advocacy project in Ghana duly launched.
We'll all be upstanding and look up to the screen for a countdown that will be counting together. So to the IT team, please let us all be 9, 8, 7, 6, 5, 4, 3, 2, 1. Wish you well. Congratulations. Viva, 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 viva. Viva, 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 viva. Thank you so much. So we can have
the doctor, you can come take some pictures. Look at if I edit, I wanted to please join us here.
Okay, thank you. You're not supposed to use a microphone today, please. Say. Yes. Please, all TGNA. Team TGNA, please let's join. Team TGNA. This issue of gender. Yeah. Thank you. Thank you. Yeah. Okay, so please, all partners and CSOs, let's join and have a big, beautiful picture. Please, all partners and CSOs, let's join. All partners and CSOs, let's join. Oh, you don't want the I was here some picture. Yes, I was here some. That's your evidence, your trump card to saying you were at the launch, Yes. I still have the pictures of Dr. Combat from the launch of the economics tobacco taxation in Ghana, He was here, sir. The pictures will show. Please, let's all join to have a very beautiful picture. Okay. Okay. Comms team, please let's have our video on standby. That's me white. Even the okay. Okay. I'm coming. Thank you so much. Thank you. At this juncture, we are going to watch a beautiful documentary. A very beautiful documentary. Very, very beautiful documentary. That was a beautiful lunch. We cannot wait to actually kick off. Yes, we thank you for the support, all partners and development agencies available, all CSOs. We say thank you so much for the support. To TJNA, we say thank you so much. Dr. Hafiz, thank you for staying this far. Thank you. Please let's give it up to him as he leaves. Thank you. Thank you. Constant, is the video ready? Okay. Enjoy. Can we have the lights off? Can we have the lights off?
Light out. Light out.
Ghana was formed with a clear purpose and vision to ensure that we are able to close the huge gap that exists between policies at the top level and then what actually is a reality on the ground. We saw this gap and then we started to ensure that we close it as much as we can. Yeah, we primarily focus on non-communicable diseases, that's diabetes, hypertension, cancers, sickle cell disease, and also advancing policies around the NCD risk factors, the tobacco, alcohol, sugar-sweetened beverages, and then now we're just looking at the food and also ultra-processed food to ensure that we're able to bridge the gap that happens in our food and then also our environment. From the onset, we realized that evidence-based advocacy is the way to go. So we ensure that whatever that we do as Ghana is connected with evidence. So we have to work and ensure that we get the data, we get the evidence, not only from within Ghana, but also ensuring that we get evidence from development partners like the WHO, UNDP, and also ensuring that we also, advance research from academia, but more about research, so that we're able to use that to advance policies. And then we've seen so many policies that have been changed from the research that we have done over the few years.
What makes Bas Ghana different is that we not just report on problems, we present solutions, we live the talk. We run coalitions between advocates, we engage the media. In fact, we show up.
Our vision, a Ghana that every person, regardless of your geographical location or your financial status, have access to protective health policies and a government that is accountable for our well-being. This is not a distant dream. It is what we do each and every day at Bas Ghana.
At Bas Ghana, we believe effective public health advocacy rests upon three strong pillars: credible evidence, strategic communication, and collective action.
So from there, we do a policy analysis where we look at what are the global commitments, what do we have within our legal frameworks. Then we gather the data, we develop the research, then we submit it to key policy makers to make sure that these transform into key policy action that can transform the environment we live in.
Relation building is a central theme of our work here at Bas Ghana. We convey stakeholders meeting, which involves professional bodies, health professionals, the government, CSOs, the media, people living with NCDs. They can tell the stories better. This is to ensure inclusivity, equity, and equality at all levels of engagement.
Also, we major in effective, capacity building for the media, CSOs, and government organizations. And when it comes to mobilization of communities to as part of the work we do, it's an area that we enjoy very effectively, and it has helped us, in the course of almost all our projects.
So monitoring and evaluation forms a key part of everything we do. With every project, with every activity, we have key KPIs that we work with.
Bas Ghana has become more credible because we live the talk, we run the talk. Our Taa's physical activity has become an anchor to sustaining the health of all staff.
Pursue the decided way of working. Bas Ghana ensure that we work collaboratively with partners both in Ghana and across the globe to ensure that we're able to achieve collectively the goals that we have put together. And we work closely with development partners like the WHO, UNDP, and other partners, and also in Ghana working closely with the Ministry of Health, Ghana Health Service, FDA, the Mental Health Authority, and other institutions, including civil society parties, academic and research institutions, people living with non-communicable diseases, and youth groups.
The environment here is one that encourages learning. You are expected to know the evidence, understand the policy landscape, write clearly, and advocate confidently. It ensures and pushes you to grow professionally in ways that matters.
I thank Bas Ghana because I want my work to matter beyond the desk, the impact that will live generations forever. Yes, because the issues we talk about, tobacco, alcohol, sugar-sweetened beverages, unregulated food environment, these are things that matter to my family, to my friends, and to myself. So these politics are not abstract, but they are the realities we live in with. That's why I'm going Bas Ghana to make a change with my little ones.
Our service as Bas Ghana has been a genuine learning experience. I came with a background in psychology and information studies, but the depth of policy work here, the research, the advocacy, and the engagement with government is a kind of exposure that you can't get from a classroom.
Dr. Hafiz Adam Tahir, I'm the Director for Clinical Coordination at the Ministry of Health. VAS Ghana partnership with the ministry is very, very solid. They come with real data and they have full understanding of the issues they are coming with. They get their research very well, and by the time they come with real data, and it makes our work very sharp and also effective. And in governance, this type of partnership moves needles. And so we appreciate the collaboration we have with VAS Ghana, because they stand out as far as their full understanding of the issues are concerned before they even get to us.
VAS Ghana understands how to translate research into advocacy without distorting the evidence. Working with the team means that our findings influence policy rather than sitting on a shelf. The translation from research to action is something that VAS Ghana does very well.
The vision for accelerated sustainable development VAS has done a lot in this country in the fight against this lot of non-communicable diseases, right from spreading the good news about what we can do to fight the disease. VAS also is involved in policy issues. Fighting against industry, ensuring that industry does not take any advantage of policy making and policy implementation. A very recent one was also when VAS collaborated with other stakeholders to fight against industry trying to infiltrate policies that were going to ensure the passage of same taxes, the excise taxes on same products like tobacco, alcohol, and sweetened beverages. I think VAS played a massive role. And as a partner, I was loving it when we all came together under the ambit that was organized by VAS. And we did some media campaigns, we did some policy engagements, and we ensured that, even the excise taxes that were taken away, actually forming the foundation for the Ghana Medical Fund that we have today in this country. And I think VAS played a leading role in that one. We are saying that, working with VAS personally, and my organization, Revenue Mobilization Africa, we stay with VAS on this call, and the Ministry of Health, the FDA, are witnesses to the work of VAS. VAS has come in here to do a lot. And the NCDs is knocking the doors. VAS has kept the door closed and tight. I believe in this.
Working with VAS has been a blessing to GRA. The research they are carrying to support implementation of excise taxes is just invaluable. They cannot be measured. They are doing a lot. GRA has not conducted any research in that area, but VAS has conducted several research to support the policy implementation of the health taxes. And we feel that they can even do more. They can do more, and there's prospects for them to support GRA more. So to this end, I would just comment about and say they should continue to carry on with their, or go on with their good works to support excise tax implementation in Ghana.
Our brand is built around three main things: clarity, purpose, and credibility. So every book out there, every social media post out there, every publication out there carries these values. This is to tell you how much VAS is invested in giving policymakers the best they can work with to improve the outcome of health for Ghanaians and all people around the world.
When people, Ghanaians, and everyone encounters a vision for accelerated economic development, we want them to see an organization that is credible, that is forward-looking, and an organization that ensures that optimal health is essential and is guaranteed through public health policies.
I thought you would do it better. Okay, so this is VAS Ghana. This is VAS Ghana. This is what we do. A 360, all engaging in policy advocacy, in community advocacy, and in behavior change communication. Thank you so much to the team. And at this point, we would call on a very important personality. She's been with us from the beginning of advocacy till now. I used to know her as a doctor, but today I'm introducing her as a professor. Ladies and gentlemen, please let's welcome Professor Artie to the microphone. Oh, we can do it better. She is a professor, please. Yes. We're talking about the whole you know.
Yeah, thank you. Thank you very much for the introduction. And I think my work has been quite shortened with this beautiful video of VAST. And it sort of summarizes everything that we've done over the years. And it gives me a lot of privilege and honor to stand here and talk on behalf of VAST and, of course, what Mr. Labram has done over the years. And I believe that he's an organization on his own. He doesn't really need any organization to follow him. He can be himself and do everything, and he will still be successful in everything that he wants to do. But I think official protocols always demands that things are done through the right channels, and I'm very happy that Vast Ghana gives him that opportunity to do all the good work that he continues to do over the years. And personally, my interaction with him has been for many, many, many years, and we've done a lot of work together, right from tobacco control when it comes to illicit tobacco trade, industry interference, secondhand smoking, just many of the works that we've done in academia. And I think between evidence and policy, there's a big word called advocacy. And that is where organizations like VAST become very, very important. We can be sitting in our consulting rooms, in our universities, in our offices, doing all the great work that we think we are doing and generating a lot of evidence. But if we don't have those channels like VAST and many other civil society organizations that really give us that voice to communicate our work, there's really no use of all the works that we've done over the years. And I am very grateful that we have so many, many organizations. And today, VAST Ghana also joins many of those organizations to add their voice to the policy that we are trying to make in terms of changes and non-communicable diseases that VAST is clearly geared towards. I think really is the big problem that we are facing as a country, as a family. And it is both, I think, more of a social issue, developmental issue, and we can think of it as the biggest problem that we are facing. And I think VAST Ghana is really here to solve many of the problems that we are facing today. They've done lots of work in many areas, and I don't want to go back to the video that was showed. And I would ask the opportunity, of course, to officially launch VAST Ghana in the midst of the great audience that we have here. And I will wait on to our lady here to give us the instructions on what we need to do.
Okay. Thank you so much. That's where I like the most. When I'm in charge. Okay. Yes. Can I have my co-moderator here? I need him when I need power, you know? Okay. I'll need some few people to be on standby for me. Please join me here as well. We have Jeff, Jemima, Dr. Wellington, Madam Esselin, Jaishi, Jennifer from the Budget Forum, Derek, Chris, Asantiwa, Mr. Fatah, Professor Ase is already here. So, John is already here. Can we have Noah? Okay. So, division of labor. First 7 on my left. Jeff, Jemima, Dr. Wellington, Madam Estelin, Jaishi, Jennifer, and Derek. On my left, the rest on my right. Please, those on my left, my champagnes. Jeff, Jemima, Dr. Wellington, Madam Estelin, Jaishi, Jennifer, Derek. Over to you, my dear.
Thank you very much. I've been called again to do some Viva business, so I hope you support me in this. Are you ready?
Yeah.
We are going to make this the most colorful launch for VAST Ghana. We really need to make them proud for having such an amazing institution. So I'll call to the floor the entire VAST team, led by the Executive Director, Mr. Labram Musa, who will just as well make just a tiny, tiny bit of comments on this whole process and what this launch in particular means for him. So I'll call upon Mr. Labramos in maybe less than 2 minutes. Tell us, what does this launch mean for you? And yeah. So after that, I'll call upon as well all staff of Vast Ghana. I call upon you after Labram has spoken. Please come to the floor.
You say 10 minutes. 10 minutes too much now.
Please, in 2 minutes.
Yes.
So wrap it up in 2 minutes. Thank you.
Thank you so much. Yes. Okay, you are disqualified. I'm good. Right. So thank you so much. So ladies and gentlemen, distinguished guests, partners, colleagues, friends, my family who are also here with me. Today is a deeply humbling moment for me and for the entire VAS staff. We have officially adored our organization at this important gathering. I stand before you not just as a leader, but as someone who is profoundly grateful for the journey that has brought us here. First, I want to express my sincere appreciation to our dedicated staff, VAS Ghana staff. Through good times and bad times, in moments of profound periods of challenges, you have stood firmly by the vision. Your commitment, resilience, and passion are true foundation of whatever we have achieved and would achieve. I will not ask for a better team. Thank you so much. Thank you so much. Thank you so much, partner. To my family, thank you for your unwavering support and for the many sacrifices you have made. Indeed, my wife is here with us today. Yes. And I also have my brother who is also here with us to join me in this moment. For my kids, unfortunately, they're in school, but I will relay the information to them. In fact, they had wanted to be here as well, but school first. Yes, and to our stakeholders, government officials, civil society partners, academic institutions, development partners, and especially our valued collaborators, Tax Justice Network Africa. Thank you for believing in this cause and working with us. Important to also acknowledge our partners like the Global Health Advocacy Incubator, Movendi International. I know some of them are watching us, live. And Corporate Accountability, Campaign for Tobacco Free Kit, NCD Alliance Global and Ghana, African NCD Network, Global Center for Good Governance, Global Alliance for Tobacco Control, Ttaa, and many other partners who have continued to be with us since the inception of the organization. We are grateful for your support. Our inspiration at VAS Ghana is clear. We want to become a trusted hub of resources on health and NCD issues in Ghana and beyond. More importantly, we want to be a strong, consistent voice, representing the voice of vulnerable and people living with non-communicable diseases. Indeed, let me also acknowledge their presence here. In fact, they are here in their midst to support this particular launch. Young people who are also here with us. Jashi, where are you? And also low income families and the future generation who are most affected by these harmful products that we are all here to ensure that we are able to regulate as much as we can. I am inspired by what is possible when we stand together. I believe in our collective potential, and I'm confident that with unity, persistence, and purpose, we would have a legacy of health and hope for Ghana, across Africa, and across the world. Thank you very much, and may the good Lord richly bless Ghana and also bless our efforts. Thank you very much.
Thank you for thanking us. You know how we do it, That's a smile.
Thank you so much. I'll invite to the floor all staff of Ask Ghana. There is a moment. So I'll like to invite to the floor all staff of Ask Ghana. Please come, please come, please come. We are waiting for you. Where are they? Clap for them as they come. Thank you for your service. Clap for them. Let us continue clapping for them. So I'll also invite you colleagues to be upstanding. Please be upstanding. And at the end of the countdown, I want you to make the loudest illustration you have ever made. So we are going to turn and watch as we start the countdown. Are we ready? Are we ready? So, yes, for those who will be popping and those who will be popping champagne and their confetti, please time at the exact 0 mark. I hope you're good students. Are you ready? So we are all turning and facing the screen. 9, 8, 7, 6, 5, 4, 3, 2, 1. Viva más viva. Viva más viva. Viva más viva. Viva más viva. We say thank you for staying with us. To children and kids, we appreciate you for the life that you and the life of the vision and for what you the vision. Let's end it by the time we have to this. Mr. DJ. Okay, this is not even going to take 2 minutes. I'd like to make a toast to Mr. LeBron, who is. I think John described you in his remarks to the Phoenix, and I think all of us can really lay testament to that. So, to LeBron and the incredible team at Last, we wish you an incredible next few years as you continue to do your work. You have our support. And I think as is visible in the room, the support of a broad range of stakeholders to us. Congratulations. Mr. DJ, you can come back now. Thank you so much. Thank you. In 1 minute, we are going to wrap up the meeting officially. Please restart it officially. Let's end so the party can continue. We must just say thank you to the Executive Director of TJNA, Chinai Ombaka, for your support to all the ministries available, Ministry of Health, Ministry of Finance, the FDA, WHO, Oxfam Ghana, Project Forum,
to Ghana, to Revenue Mobilization Africa, to Spider, Maxpo, all of you, we say thank you so much for coming. And our online participants, we also say thank you to Movini International and the rest. We say thank you to PA. We say thank you very, very much. We really appreciate this. Now, thank you. Please, this is where I need all of you. A very big thank you. And there was silence. I love that. Can I have the wife of Mr. Labram rise onto her feet? I'll do that. Okay. We say a very thank you to you, Hajia. Thank you. I know my boss comes to work very early and goes home late. I'm like, thank you. Thank you. Yes, he comes home very early and leaves very late. Until I got married a few years ago, I couldn't relate. Now I can relate. Amelia, thank you so much for keeping the family together, for giving him that peace he needs to undertake all these projects. On behalf of everyone gathered here, we say thank you. Please give us just a minute of any goodwill, any good wishes you have for us. We will take. Thank you.
Anyway, thank you very much. In fact, it hasn't been easy, but we thank Allah for everything. If I want to talk, in fact, I won't finish now. But we always pray for endless strength. Because the strength that He's giving us till this time is still not easy, but we say Alhamdulillah. I have no much, I have very little to say. All I want to say to him is that he should keep fighting. No matter what, once you have life, there's a lot of challenges that would come, but that shouldn't deter us from whatever we want to do. We should keep going till they said what? It is not the end until it is ended. So till they said close the sun and everybody leaves. Once there's life, everything still goes on. So let's keep that up and then we pray for your support as well because he can't do it alone. Thank you so much.
Thank you. Thank you so much. We really appreciate it. Thank you. In fact, we pray that even as he's embarking on his professional work, he will also be romantic. Thank you. Okay, on that note, please, do we all have our cheats? Do we have our lunch coupons? Have we all signed? Do we all have our toast bars? Please, one object I requested for a post. Now, that is in session. We are on all social. Our social media handle is not protected yet. Please follow our post, share and retweet. Thank you once again for coming. Tomorrow when you get a talk and it's last time saying thank you. Then we have appreciate you. We say keep reporting, keep giving us praise for that and keep supporting the mission. So please again, some other time and again, Ophelia and the day of the hand and speak on the frame. The frame protection outside. Outside.